Attention, please. Would members of the Community Development and Recreation Committee please report to Committee Room 1 for quorum? Thank you. Attention, please. Would members of the Community Development and Recreation Committee please report to Committee Room 1 for quorum? Thank you.
Hi, good morning, everybody, and welcome to Meeting 8 of the Community Development and Recreation Committee. Special welcome to members of the committee who have attended, who are attending, and members of council in attendance today, and of course, members of the public. For those in the room with us, the screen at the back of the room provide real-time updates concerning where we are in the agenda and what's coming up next. Should the room lose pressure, masks will come from below, and you're to put them immediately on your face.
I need one now.
Of course, should water enter the room, underneath your seats are flotation devices that you're supposed to grab onto right away. You can also follow the agenda and debate on your computer, tablet, or smartphone at toronto.ca/council. Any declarations of interest under the Municipal Conflict of Interest Act? Hearing none. Confirmation of the minutes of October 15th, 2015. Councillor Cole, I see your hand going up aggressively. All those in favor? Minutes are confirmed. So we have some speakers and presentations today. Let's review the agenda. So 8.1, progress report on the Toronto Seniors Strategy. We have a presentation, so we'll hold that item. 8.2, award request for Zoll Medical. You know what? I think we're going to hold it. That's a lot of money. 8.3, update on specialized program for interdivisional enhanced responsiveness. Councillor Matlow has some comments and questions, so I'll hold that in his name. And there is a deputant. That is correct. 8.4, there has been a request by a committee member to time that for after lunch. I'll tell you what, I will hold it. I'll hold the item, and we'll squeeze it in as people arrive. (8.5) Community Investment Funding Programs, 2015 allocation recommendations. If I'd like to move it. Oh, Councillor Cole. All those in favor? Opposed? That's carried. (8.6) Comprehensive review of the state of community-based sector. So we do have a deputant for that item, so we will hold that. And options for 702 Kennedy Road, 8.7. And there are speakers, so we will hold that as well. Yes, so there is, I'll be holding the item 8, the rents, it's a deferred item, rent supplement agreements. And there has been a request by myself to have a briefing on the federal announcement yesterday on Syrian refugee settlement. And originally, it had been referenced to after lunch. There seems to be a feeling in the room that this agenda actually could be completed by 12:30. So why don't we just keep that open? If we have to amend the agenda as we go, I think there's enough flexibility in the room to do so. So expect a short briefing on the federal announcement yesterday on the settlements of Syrian refugees. Okay. So just for procedural sake, if I could have a motion to add that 10-minute presentation to the agenda. Councillor Cole, all those in favor? Okay. It is added. Okay. So All right, so we've got some deputants. Why don't we go to our presentation first? On 8.1, progress report on the Toronto Senior Strategy. There has been a handout to all committee members and guests. And please proceed.
Good morning. My name is Andrea Austin. I am a Policy Development Officer in Social Development, Finance and Administration. We're the division that's charged with coordinating and leading the Toronto Senior Strategy. To my left is Dr. Samir Sinha. He is the head of geriatrics at Mount Sinai Hospital and the lead for the Ontario Senior Strategy. He wrote this report to the Minister of Health about living longer, living well. And he's been working with us for several years now in partnership to develop, implement, and now reviewing and monitoring progress on the Toronto Senior Strategy. So I'll turn it over to him.
The audiovisual working, so if you could help with that. So thank you very much, and good morning. So Andrea and I will be presenting an update report on the City of Toronto Senior Strategy. And really what we will be focusing on is talking about the implementation of the strategy, why we're doing it, some of the key highlights, some of our challenges thus far, and our plan for 2016. As Andrea indicated, that this has been a collaborative process that's been occurring since 2013, and the 91 actions that the Planning Committee, which was a bunch of Toronto citizens, but also members from various city departments, many who are represented here, including many members from our Citizens Council, contributed to developing the first strategy with its 91 actions that Council adopted on May 17th, 2013. So here we're going to highlight some of what we accomplished. We're going to talk a little bit about which recommendations have not been implemented to date, and what the plan is to finish implementing the strategy thus far, in particular. So in terms of what we did in terms of our overall process, we really focused on making sure that during our first part was really just doing a broad consultation. We also tried to align this, as Andrea was saying, with the provincial senior strategy work that I was helping to lead for the Government of Ontario. So we got a broad group of stakeholders together who represented everything from healthcare to community support services, public health, fire, paramedics, etc. And all together, we were able to come up with our overall plan and strategy, mainly responding to the fact that Toronto is actually aging faster than ever before, and we have a significant growing demographic who needs this support as well. As you can see, we really focused, as well as we developed the report, is we want to make sure that we would be able to hold our colleagues accountable, mutually accountable, towards seeing the successful implementation of the report. So this is a cycle that we implemented in particular. And what we really did was we wanted to make sure that there was some accountability with city managers and leaderships like Andrea and Denise and her team and Chris Perlinger, and then also making sure that we had our expert table would meet on a regular basis to review the progress, but also to help our city colleagues troubleshoot and make sure that if we weren't getting some movement on some areas, what did we need to do to help facilitate that with our city partners as well. As you can see through our process as well, we have created a system where we're monitoring, we're reviewing, we can refine, and we've actually released our report now, and then this is going to go to council soon as well. So in terms of what was the overall progress on the actions that we put in so far, as you can see, when we started our work, there have been previous strategies that the City of Toronto has created, and between 1999 and 2010, you can see that not all the recommendations were fully implemented, and more were only partially implemented at that time. And that was largely because in previous recommendations, there were things that were going forward towards the federal government, for example, or the provincial government, things that were outside of the city's jurisdiction. So this time, when we were working for this first iteration of the new Toronto Senior Strategy, we really focused as a group to try and say what were things that are within the city's domain that we can actually do and influence to really move things forward for older adults. So I'm happy to say for the last 2 years of this new new type of strategy, we've actually seen that 95% of our recommendations have been either fully or partially implemented, and only 5 recommended actions have not yet been implemented thus far. So this is a real, key milestone to really reflect on how we made progress. And I think, from the point of, not from the city manager's point of view, but the fact is we have a broad group of citizens, busy citizens and organizations who still come to all the accountability table meetings because they see good progress that's being made. So Andrea is now going to speak about what our actions have been and under the domains that we've actually formulated this. We've really focused on the World Health Organization framework of age-friendly cities, and you can see the 8 broad categories over here. And we really want to make sure that we were aligned to this as well, and even one of our first recommendations to make sure that we actually applied as a city for age-friendly status with the World Health Organization as well. So really kind of to reflect the work that we've been doing, but also our commitment to move this agenda forward, that again was unanimously supported by Council 2 years ago, and we hope will continue to have the same level of support. So now I'm going to pass it over to Andrea, who's just going to review under each of the 8 domains some of the highlights that we've actually accomplished thus far.
So of the 91 actions, we were able to make significant progress on 86. So I'm not going to go through a list of 86 actions with you very, very quickly, just going to highlight a few. Under respect and social inclusion, we heard through the consultation period that Torontonians asked us to train staff to better be able to recognize vulnerable Torontonians and seniors and be able to respond to them. So that doesn't mean that we would create social workers out of all city staff, but that there is an enhanced duty to care on behalf of all city staff to be able to recognize and support vulnerable Torontonians. So we instituted a Guide to Good Practice, which is new vulnerability training for city staff in 2014 as a direct result of the Toronto Senior Strategy. Moving on to civic engagement, volunteering, and employment, we had the first of its kind ever event for older Torontonians who are seeking employment. As we know, older Torontonians are increasingly looking for work, sometimes out of desire, sometimes out of necessity. So we responded and created that event for seniors on October 9th during Workforce Development Month. Over 125 people came to learn more about how to best position their skills and experience to get back into the workforce. In terms of social participation, we are redeveloping 5 long-term care homes. So as you know, as a city, we're working to reimagine long-term care and to break down the walls. And a great example of that is the George Street revitalization, which will combine a long-term care home, an emergency shelter, assisted living, affordable housing, and a community hub, all under one roof. Under the community support and health services domain, we have 2 community paramedicine programs which aim to reduce pressure on our emergency service system by engaging more appropriate community-based care. So the CREMS program allows paramedics to refer patients to a community care access center for appropriate non-emergency community health and support services. And as part of the Toronto Senior Strategy, there was a request that those referrals go up by 10%. They have more than doubled in the past 2 years, and 70% of those served are seniors, and very similar results with the CAN program. So these programs redirect the 911 call to the appropriate community resource, thereby saving public dollars and benefiting mostly seniors. In terms of housing, again, through the consultation, we heard that one of the things that Torontonians wanted was for the city to increase the supply of affordable rental and ownership housing for low-income households, including older adults. So the Mayor's Open Door program is the subject of a robust report to the Affordable Housing Committee on November 26th, with 24 recommendations to increase tools and incentives the city has to speed up the delivery of affordable housing. But we've been able to either secure or replace 1,750 affordable housing units in 2014. In 2015, We flowed over $2.7 million in federal and provincial funds to disabled or seniors' households to do the home repairs necessary to allow them to age in place and retain their independence and to stay out of long-term care. Under transportation, Torontonians and older Torontonians in the consultation process told us that they wanted improved safety for all road users. So this is just one example of some work from Transportation Services on Bayview and Finch to allow more space for pedestrians when they're waiting to cross, reducing the need for a two-stage crossing, and also accessible pedestrian signals. In terms of outdoor spaces, from the direction of the Toronto Seniors Strategy alone, we've put 500 new benches around residences, around seniors' residences primarily, and also 512 new benches in city parks. We've also put larger print signs at intersections, many intersections across the city. Finally, under communication and information, we have increased access to information for vulnerable seniors and their caregivers. Again, this is something that we heard during the consultation that seniors wanted, so we have many of these available. These were released in 2014, and it puts all of the information in one place about what services and programs are available for vulnerable seniors and their caregivers to help them maintain their independence and age in place. So there's information there about housing, legal and financial, transportation, health and wellness, education, employment, volunteering, and much more. So that's it for the highlights. I'm going to turn it back over to Dr. Sinha to talk about the challenges.
So as we said, that we were able to, of the 91, we were able to make very good progress on 86 of the recommendations. And I don't work for the city. I'm not an elected official, and I like to hold people accountable. So I can say that we're really proud that we've actually been able to work with our partners to move this work forward. So that's the good news. These are just some of the recommendations that we're still, that we haven't been able to implement yet. And just very briefly, actions 1 and 5 require some further action on the part of the Toronto Police Service, which we're working on right now. And in fact, right now, the Toronto Police Service has really engaged with us more fully in this strategy in this past year. And actually, their big community engagement day on Saturday this week is actually all around seniors and policing, for example. So I really commend them for that. Actions 3 and 4 require significant new resources, and we currently don't have that. Dental care, for example, is something funded through the Ministry of Health, for example. And again, it's something a little bit out of our control, but something that we still know our colleagues from public health here know this is an important issue, and we're certainly partnering with them to see how we can move that forward. Action 2 requires the support of our school boards, for example. And while there's some intergenerational programming that's happening and supported through various city programs, again, we also need our partners at the school boards who have also a lot on their agenda to help us action. I think one of the challenges we learned, as we started working on this is we actually accomplished all of this without any dedicated funding, any dedicated staffing through the city. So we've actually been able to accomplish a lot with nothing, but a lot of goodwill and partnership. And so that might be something that we can reflect on in future iterations. I know that's beyond the scope of this committee. But the other aspect is we did a lot of learning over the last year, last few years, in terms of how do we engage different parts of the city appropriately. So our example with the police services group was understanding that that it is governed by an independent board, and therefore in order for us to move things forward, we need to engage with that board as opposed to going directly to managers. And I think by respecting the process that exists, we've been able to actually get a lot of good positive movement, and we're really proud of that as well. So we're learning as well as we engage to move forward. So in terms of a plan for 2016, as many know, that this report will hopefully go on to council and for reflection that way. And then our goal for 2016 is we'd like to continue the full implementation of the recommendations that are partly or have not been implemented thus far. But we also have agreed, and we do have support of a number of councillors, but also I know our mayor has demonstrated interest in also looking at how do we actually think about a senior strategy 2.0. So I think there's a lot of excitement from both the stakeholders, but hopefully from our council as well, so that we can really focus on a refresh and a new strategy as we move forward in 2016. Thank you.
Thank you.
Great. Well, thank you very much for the presentation. We can proceed in two ways to committee members. We can ask the deputants questions now, and they will count as a first round of questions to staff. We do have other deputants on this item, so we want to hear them as well. So if we have questions for the presenters, then we should proceed now with that. And that will count as a first round as questions to staff. Yeah, I'd be happy to clarify, Madam Vice Chair.
Presenters.
We can ask the presenters,
can ask staff.
and if we want to go to a second round of questions, we can ask staff. What has happened in the past here is we have spent a large investment of time to presenters, which is fine, and then we go to a second set of questions for staff. We end up duplicating a lot of the work in a less efficient way. So, questions for the deputant. Councillor Cole.
Thank you, Mr. Chair. Thank you for the presentation and all the work you've done. And I don't know that there's an easy answer to this question. In my 5 years as a councillor, I often kind of joke one of my informal roles is kind of surrogate son for many of my older constituents who need help in many different ways. And one thing I have found is that as you know, we often talk about a senior who is house rich, cash poor, but also with that conundrum comes a lot of issues around. I saw snow clearing, and a lot of the issues that come with this desire to maintain the kind of the original family home. I certainly know in my ward, you know, especially in certain cultural groups, they will not downsize. They will not look for you know, a setting that's more maybe meets some of their needs. Has there been any discussion around that? And I don't know, I would never want to force any of that or push any of that, but any discussion on like how we start to tailor services or even the discussion or even educating their children to help address some of these issues?
Absolutely. I think these are some of the broader conversations that we have at our broader accountability table where, again, these are longer meetings, 2 hours in length, where we really get everybody to say what's on your agenda, what are you moving forward, and how do we use the strategy to move some of those issues forward. These are common issues, right? We find that people are wanting to age in place. People don't want to leave their homes and be institutionalized. For all of us as taxpayers, it's more expensive for older adults if they become institutionalized as opposed to providing some of those basic preventative services that maintain independence, such as basic things like snow shoveling, which is largely, that's provided by volunteers who are coordinated with very little bit of, city funding to provide that coordination of those volunteers through grandfathered programs, for example. But other things like our community paramedicine initiative has been incredibly helpful because we have a lot of vulnerable older adults living, for example, in Toronto community housing buildings who are constantly calling 911, going to hospital, mainly because they didn't know that they weren't connected to a primary care provider. They might have outlived that primary care provider. They may not have access to some basic home and community care services which are available to them. And so that's been a hugely enabling program that's seen call volumes in that program drop by 50% with some of our highest callers in the city of Toronto. So it's about thinking about how we do things differently and also making sure that people are even connected to the services that exist. I always say sometimes in some cases we're service rich, but we're knowledge poor in terms of how do we connect them. So, making sure that we do a better job of connecting people and even knowing that, you can defer your tax rent increases. We have that policy in Toronto, but most of my older patients don't know that. And that could enable them to deal with some of the other inflationary costs of just living and aging in place. So this is where, we've done this without any budget. Where we've actually been able to bring together the coalition, the willing. But I think there's an opportunity to say, how do we start doing this in a more enabling way? So as councillors, for example, you're better enabled to support your constituents as well.
Thank you. And just you kind of teed up my second question for me nicely in terms of that knowledge gap you identified. have we done enough, or is there more to do in terms of leveraging some of our cultural networks and associations? Because the reason I say that is, sometimes there's a level of trust through that network that might not exist from, the government, so to speak, going directly to some of those members. And I find within those communities, those are the people who often get lost and who don't know the kind of full suite of services that are available to them, regardless of how, much we're promoting them in conventional spaces.
Absolutely, and I think, this is, our diversity is our strength. It's also our challenge in this city. And there are people who will naturally go to their local faith groups, for support. And part of our job, or part of our focus has really been, how do we better support people from ethnocultural communities, or just diversity in all of its aspects, by empowering those groups to know what services they can connect their members with, for example, and vice versa as well. So that has been a big focus of our conversations as well. But I think, again, as we start thinking about 2.0, we hope that, as councillors and the broader group of councillors can contribute the thinking to what are the things we next need to do. And, from your experience, being the son to so many, as you said, what are the challenges you're still struggling with that we can better support you as a councillor, but better, most importantly, support your constituents as well.
Yeah. Great, thank you. Thank you, Mr. Chair.
Thank you, Councillor Cole. Councillor Burnside? I thought I saw your hand go up. No? Councillor Fletcher?
Thank you and good morning, and again, thank you for your work. I've had a few people talk to me about an innovative program that they have in New York, which are community meals for seniors. Have you heard about those?
Community meals for seniors?
Yes, where they may go to a rec center and they're having meals, or they may go to a school or a hub, and there's meals there. And it is an innovative program. Are you aware of that one?
Yeah, I mean, we have a number of different meal options available for older adults. Those are largely supported through our community support service agencies across the GTA. So I think I saw some of my colleagues from Sprint, Vonnie Barron from Sprint Senior Care, for example, and we've got a number of LumaCare. We've had a number of different groups here, for example, in the city that do provide Meals on Wheels, which we all know about, but also congregate dining, where that might happen in a gym, or it might happen in a church, or it might happen in a congregate setting, or even getting groups of people together and taking them out to a restaurant for a subsidized or low-cost meal. Even some farmers markets that are being brought into community housings for seniors as well. The key is, the key with these programs is how do you make sure that people can get the nutrition they need, but the benefit of the community dining programs that you've mentioned, you've seen about in New York as well, as we do here, is about creating social cohesion and helping people actually reduce social isolation, which can be a real big problem. It's a growing issue in our city.
So you've touched on social isolation, and Meals on Wheels is great, but you're eating often by yourself in your own home, which isn't great for seniors at that point. Would you agree that community dining, if you want to call it that, also allows for, a social worker to be there, a nurse or somebody to touch down in that space every once in a while and look at other services?
Absolutely.
And is there a recommendation to expand that in any way?
So these are the things. I think we would love to see more of that happen. Of course, that comes down to funding, and the funding for that largely comes out of the some of the budgets that we have through our local health integration networks and so on. So part of this, there's an opportunity here if we feel that this is I actually am a great believer in these programs for all the benefits you said. It reduces social isolation, it creates better connections, it may actually help people identify additional supports they need, and it allows us to connect with them and maybe introduce them to other services over time. So these are enabling services. The question is, if we do think that, there's a benefit to them, sometimes we can't wait for the province to kind of move on certain things, especially if we think there's a civic benefit, then is that something that we make an initiative like the idea of snow shoveling or other things to help move those things forward. So I'm a great believer, and I'd like to see more of those things, but sometimes it's balancing the choices. These are the decisions that councillors have to make.
The other two things very quickly are for seniors traveling. You had to sign up the larger sign, Arlington, but there's no address on that sign. Are you aware that in past days, you'd actually have the street address there? So if you're a senior who may be walking or whatever, or anybody, you know where you've arrived.
Yeah.
And you know the intersection that you've arrived at. Would you not think that that is better than simply having large letters, that there is the identifier of that municipal address as well, where that street sign is?
I think it's a great idea, and absolutely, it's so I think, these are the opportunities where more ideas like.
Head nodding, yes, a lot of head nodding.
No, absolutely. So, I mean, these are the things, for example, I'll give the example of park benches, for example. We order park benches out of a catalog here for the city. And then the key is what we did was we partnered with the City Parks and Recreation Department 2 years ago with my excellent colleagues, Jeff Fernie and his team at Toronto Rehab, who's, they're the best research folks on rehab in the world. They create an evidence-based briefing note for our city staff to say, if you're ordering out of the catalog, get this bench. It costs even less, and it actually is better for the older person. Just things like that. And, for, the work with the TTC, for the work with our police services, we're just trying to bring those ideas. So, I think what our group has really come up with is the idea that we want to now build on our strengths. We actually think we've made some progress. But I think now that we're getting more awareness of what we're doing, I think, being able to engage more council members and more folks in a second round of best ideas and put those forward. I think it's sometimes when we talk to city staffers, they said, nobody told us about that. What a great idea, let's move that forward. And sometimes it doesn't cost anything more to do those great ideas too.
Yes, and the last one just has to do with lights, where in order to cross, you have to press in order to get the actual countdown, pedestrian countdown. It doesn't come on automatically. Are you aware of that? It's a little confusing at times, and it's a much shorter crossing time if there's no pedestrian countdown on streets that don't have a lot of pedestrian traffic. There's many of them that are near old age homes, and it's taking your life in your hands. But has anybody identified that to you as an issue before?
So I can mention that, one of the focuses on, under our transportation recommendations, where they actually have lengthened the street crossing times at several intersections in the city, where they did notice that was an issue, for example. And again, the two-stage crossings, which I never follow on University Avenue, and I run for my life every day. So I'm going to keep bugging everybody around that one. But regardless, they've eliminated that on, you don't want your doctors to be, and nurses to be dead here. But the point is, again, thinking about those opportunities to say, if this is a safety issue and a crossing issue, how do we elongate that? So I'm proud to say, at least we saw that the city, the transportation group did actually elongate the crossing times at several crossing areas, but there may be opportunities to do more of that as well.
And how would you see that initiated? Would you want us to ask you to look into that? Would you want us to ask our transportation staff to look into that?
Andrea?
We're at 6.5 minutes.
Yes, I understand.
So we're working with Transportation Services, sits on the accountability table. So we'll be bringing that through to the accountability table. And these are things that we need to identify for the next evolution in the Toronto Senior Strategy.
I will identify them, and I'll also speak about it when I talk. Thank you.
We can go to a second round if you wish. Yeah. Any other questions? We can go to visitors. We can digress. Yeah, I just have a couple. When it comes to Toronto's application to the World Health Organization to join the International Network of Age-Friendly Cities, I guess the first thing that struck me, I was surprised we're not already a member. Now, there's various baseline assessments and protocols to proceed. Does that duplicate the work we're doing, or does it harmonize with what we're doing?
So it actually harmonizes what we're doing, because when we started our work 2 years ago, previous frameworks were, intuitive to a certain extent, but not necessarily structured, using an evidence-based framework. So Andrea, Denise, and Chris and their team at the city, our group basically said, why don't we harmonize it with the World Health Organization framework, which is those 8 domains that you saw. And certainly that work then, starting 2 years ago, we have to show that we're making progress. So I know I had some communication with the WHO leadership yesterday who are looking favorably on our application because, again, they don't want to just say that we're doing, we say we're doing a strategy. I think they were quite impressed when they saw the very detailed report our city staff put together showing actual progress we're doing and aligned with those domains. So I don't think in any way it would conflict. I think it would actually, it keeps us, in a harmonious, kind of combination to the framework that exists. But it also gives us kind of an opportunity that we don't want to lose our status in future. So it gives us an impetus to continue working on this as well. Andrea?
And if I could just add, it's not an easy thing becoming a WHO age-friendly city. It requires a 3-year action plan, so it requires the kind of thing that we've done in the first round of the Toronto Senior Strategy. And we had to demonstrate progress. We had to demonstrate things like today that we're bringing it back, that we're doing that we're monitoring our work, that we're refining and evaluating, et cetera. So today is part of that process.
And there are only 17 cities in Canada that have the designation, and actually New York City recently acquired it under leadership of their mayor as well.
There's already 17 Canadian cities.
Yep.
Okay. On the report here, it says that under progress update fully implemented, but we still haven't heard, and it's expected, I guess we're reasonably confident that in 2016 we will get a favorable response. I guess it's good to be confident.
Yes.
I'm sure
I know more than I can say.
Well, we can keep it a secret here.
There we go. Absolutely. No one will whisper what I got in an email yesterday. Exactly.
When it comes to police services, there's one of the big challenges in the seniors population is fraud and scams and price gouging, taking advantage, whether it come by mail or telephone or what have you. And there are several recommendations for police services to act. Just reading through some of the nuanced language, and I don't want to be unfair, but it seems they're slow off the mark, like they're bringing things forward, in the coming months or in the next year. Do they need a little bit of a push from council to be a little more robust when it comes to protecting seniors from criminal elements?
I think, so I think when we were reviewing kind of the progress that was being made, we didn't feel that those recommendations that were done in partnership with the police service were moving as quickly as we would have hoped. And so when we engaged again with the police service, we realized that, again, their governance structure is different, right? They report to a board, just like the TTC staff report to a board, for example. And so meeting, it was actually by chance, I met with the chair of the Police Services Board who said, why didn't you tell us about this strategy, for example? He said, we have so many different things happening on our agenda, that clearly this is a valuable thing and we want to enable that to move forward. So I have to say, with respect to the police services, Andrea and I and Denise were invited to the Police Services Board in July. We presented. The board passed a motion to expedite the 11 recommendations that were there. So all of the progress that has been made has been done within the last few months. That doesn't mean that I'm letting them off the hook by any means, but it means that we're actually having some good progress. And the fact that they've decided to make their community engagement day this year all around seniors, I think is really speaking to their willingness to take this seriously and maybe catching up to their paramedic colleagues and their fire colleagues who are also kind of leading the charge as well.
Okay, great. I see my time is up. I did have a couple more, but maybe I'll ask them a little later. Any other questions for the presenters? No? Councillor Bello.
Just a question around housing, and I want to follow up on the point that Councillor Cole made about we have a lot of housing for seniors. And I know that other countries have been exploring this concept of intergenerational housing. Can you talk a little bit about successes that we've had in other parts of the world about that?
Yeah, so I mean, there are some great examples where, again, it's the opportunity to actually, to not ghettoize people, if you will, by saying, seniors here, and different age groups there. There are a lot of nuances when it comes to housing, in particular. Before I moved to Toronto, I was in Baltimore, for example, and there, there was a policy to say just, in a bit of a housing first kind of policy, just whatever the space is available, put someone there. So you had seniors buildings that had very different populations throughout, and then people started feeling unsafe in their own buildings, just due to some of the social challenges we had there. And it actually was a negative implication. But, when you talk about the models you've been hearing about, this intergenerational concept where you have younger people, for example, who may get subsidized housing themselves, but their obligation that comes with that subsidy is that their community, they're participating in the community, maybe by providing services or supports, being able to be there as a resource, for example. And those models have been incredibly successful. And it's really about engaging younger people in different ways where they may be having a tough time paying rent, so we allow them, but we're actually asking for payment in other different ways as well.
We could actually partner that with, getting the young people some affordability, but also we have a program in Toronto with Toronto Renovates that when people need, so maybe if a senior doesn't have the funds but needs the funds to do an extra room or an extra washroom in order to create that affordability, maybe that could be included, and we actually bring this new unit into the market, and at the same time having the affordability of the senior and having them aging in place as well.
Absolutely, and there's different ways, right? I mean, low-income housing or affordable housing is not just an issue for older adults; it's an issue for younger adults as well. And so there's the opportunity to say, as we start looking at some of the allocations, there's a huge waiting list for folks.
Yep.
But there may be an opportunity to say, as new units come online, do we look at different ways, in order to actually offset the cost of services that we would otherwise have to provide through the city by saying maybe through some rent subsidies, there's an obligation that comes in a different way. And there are a lot of people actually quite willing to do those sorts of things because, they get benefits from their side as well by being able to give back to the community.
Thank you.
Great. Well, thanks very much. We may come back to you with more questions later, but we're going to go to deputants. Thank you very much. Excellent document, excellent work, and I'm sure the committee will support its continuation. I'd like to go to deputants now. First on the list is Sue Lance, Board Chair, Ontario Gerontology Association. Thank you very much for coming. You have 5 minutes.
There I am. Thank you. I'm Sue Lance, the Board Chair of the Ontario Gerontology Association. It's a volunteer role, and I've been serving on the accountability table for the city, working with the team. So thank you very much for allowing us to speak today, because as you can see by the room here, there's a lot of excitement about this strategy, and there's been a high level of engagement, and it's been a pleasure to work with Josh Matlow, Dr. Samir Sinha, and the team at the city, particularly Andrea and Chris. So I just have a couple things to say. First of all, I want to just commend the city on the approach that has been taken, because as we've heard, there's been a very specific focus on concrete, actionable change, and not the emphasis on let's spend lots of money, but let's look at how we can use our resources more wisely, creatively, and weave sort of a tighter net of support. I love the idea of the fact that the councillors are sons and daughters of our city seniors. It's the truth. You often hear the issues. So this approach that's been taken has been very successful. And leading into the World Health Organization application, you're on a strong footing. And getting that designation is not easy, and it's prestigious. So if the City of Toronto gets that designation, we should be proud, and there'll be more to come in terms of maintaining it. So the approach has been very deliberate, and there's been a high level of engagement and involvement by the grassroots. So you've got top down, you've got bottom up, and it's been very successful. And I just want to, I guess, commend the whole team. And particularly, I wanted to cite one example that Andrea mentioned today, which is the CREMS and the CAN, which is the Community Paramedicine Initiative in the city. That's just a classic example of where the city has changed its behavior in a way. By the EMS staff have taken on a different paradigm of community paramedicine, and by virtue of that, when they go to a call and they see a senior that is vulnerable, they do something with that. Rather than just take them to the ER, they refer them and connect them to either the CCAC for services, or they refer and notify the existing supports that person has with their consent, which allows those supportive organizations to know the person's been into the ER, or to know they've been called, the EMS have been called, and it allows for the supports to follow through. So it's sort of, the concept is creating a better net and catching people as we can, and whether that's in a counselor role, or in a community agency, or an EMS staff, or a physician's office, or a church group, it's weaving that tighter net. And so these specific recommendations are, that have been acted on are the beginning of that tighter net. And I guess all I want to say, and as a final sort of remark, is that you've got a gold mine in this accountability table. You've got a gold mine in Josh's leadership on this. He's very passionate about seniors. The city can do phase 2.0, I think very successfully, building on the foundation. And I think that I would close with saying there's no shortage of ideas, like the suggestion that was made around the New York model of community dining. We heard last night at a town forum that New York City's cabs and limo businesses are working together to serve seniors, to get them transported to appointments. These are, the next phase of this could also involve more businesses. Think of the culturally focused sort of the different restaurants in the city and the different food types, and how these kinds of community dining experiences could be done in partnership with some of the businesses. We can be doing a lot more creative things, and we just need the support mechanism and the leadership by the continued leadership by the city to help enable that. So thank you very much. We need to think about now. We need to also think about the future. There are more seniors coming to Toronto, so this is a pitch for keep going and keep on the track. So thank you.
Great, well, thank you very much. Any questions for the deputant? No? Okay, great. Thank you very much for coming in. Lillian Wells, Toronto Network of Organizations of Seniors. Thank you very much for coming. You have 5 minutes.
I would like to commend Sue on her comments, and I agree with them. I'm Lillian Wells, and I'm representing the Toronto Network of Organizations of Seniors. This includes the Toronto branch of the Canadian Pensioners Concerned, of CARP, of CareWatch, and the city's own Toronto Seniors Forum, and the Toronto Council on Aging. And we are also, many of us, several of our organizations, are partnering with the city in working to enhance the forwarding of this project. Toronto Council of Aging is working at a community level, working with local agencies and businesses to enhance this from a community-based, and I think the Toronto Seniors Forum will be speaking later, so I won't speak about what they're doing. We want really to commend the city on its work to date and its commitment to evaluation and documentation of the process. We're really pleased that the city is valuing the input of older adults themselves in this, and ensuring that the voices of older adults are encouraged and also responded to. Becoming an age-friendly city is an overarching framework for the city that is committed to develop, and recognizing that this will be good for residents of all ages. As the World Health Organization notes, it aims to enhance and to extend the active participation by residents regardless of their age, by removing barriers and ensuring inclusiveness and respect. We have two issues that we think are critical to move on. We strongly recommend that a counselor be appointed to a leadership role as being responsible for seniors in the City Council. The second is that it's critical that a seniors lens be adopted by council and by staff so that all policies, programs, and activities, including budgeting, are scrutinized to assess how senior residents of Toronto would be affected. And those are the major points that we would like to make.
Great. Well, thank you very much. Worthy comments and good suggestions. Any questions for the deputant? No? Okay, great. Thank you very much for coming in. Francis Chapkin, Toronto Seniors Forum. Maria Smith?
Yes.
Sure. Absolutely, that's fine. Thank you very much for coming. You have 5 minutes.
Hello, so I've been introduced already. It's Maria Antonieta Smith from the Toronto Seniors Forum. The Toronto Seniors Forum is very proud to have been an active member in the ongoing process towards making Toronto an age-friendly city. The TSF want to express to you our satisfaction with the many accomplishments that have occurred in all the 8 WHO themes of age friendliness. Many actions that have not had a great cost to the city are going a long way to address important determinants of health. For instance, we celebrate particularly the over 1,000 new benches that have been placed both on the street and on parks, as well as the blue priority seats on the TTC, all of which makes it easier for older adults to go out and participate in social activities. The strategy was designed such that each recommended action is SMART, specific, measurable, attainable, realistic, and timely. It is critical that the city apply a seniors lens to all decision-making and that this permeates through all city agencies, including those governed by independent boards. With that in place, we will be able to obtain better accomplishment in a timely fashion. There is much more work that needs to be done. Medium and long-term recommendations have yet to come to completion. Now, on the future work of the senior strategy, we want to stress the following. This is what we hear from our constituencies. The principle of respect and social inclusion is paramount to a healthy aging city. Seniors don't want to be segregated, but seniors are equally affected when segregation and discrimination affects other age groups in the city. Seniors are grandparents, are parents of other age groups, therefore we are all formed that community. We particularly encourage the next step on actions related to a public education campaign to combat ageism. That's something that is in the recommendations and we hope it will come. Civic engagement, promoting greater consultation and inclusion on processes and decisions, make it a more accountable and participatory government. Expansion of dental services and a more affordable cost of transportation are priority demands we hear from seniors all over the city, and so are you. You know that these are the most big barriers for seniors in terms of health and in terms of their participation in society. So we hope that these recommendations included in the senior strategy will see the light in the near future, because they are part of the recommendation. Finally, I want to say that the accountability table and its staff have been really instrumental in moving the strategy forward. On behalf of the Toronto Seniors Forum, I ask you to support the motion in front of you this morning to continue the work towards making Toronto the age-friendly city. Thank you.
Great, thank you very much for your comments, most insightful. Any questions for the deputant? No? Great, well, thank you very much. And now I believe we're going to Francis. Francis Chapkin, Toronto Seniors Forum. Thank you very much for coming.
And thank you for allowing me to speak. My name is Francis Chapkin, and I'm going to speak in a very personal way. I'm going to be 90 years old in the next month.
Wow.
And in my lifetime, I'd like to see Toronto an age-friendly city. I was born in Toronto. I lived in North York, and now I live in the largest city of Toronto. And I helped Josh Colley get elected when I lived in that area. I have been a lifelong learner, and I find this process that we're going through very exciting, because not only am I being able to give a contribution to the concerns of seniors, but I'm also able to keep on learning and hearing all kinds of new suggestions. When I joined the Toronto Seniors Forum, this project was being initiated. And it's really exciting to find that this is the first formal report going forward and will be voted upon, no doubt, by all the councillors if they're wise enough to do so. And I certainly hope they are, because everybody who got elected this time is the person to do so. The Toronto Seniors Forum presently has 3 issues. We find that, if you have too many things to work on, that it becomes overwhelming. So what we chose was housing, which has been addressed to, and that is affordable and suitable. And transportation, which also has to be affordable. And I did try to get into the room yesterday, but I didn't succeed in making a presentation that you do something about seniors' fares. And I know something will be forthcoming in the near future. Okay? Promise me. The other area is health. Now, we've already heard about the need for dental health for seniors. I know we do that for children, but seniors need to be able to keep on chewing their food and to be able to communicate, to talk properly. And we know that that comes from a different level of government. And that's why it's important for us to have, as Lillian has recommended, that there be a counselor who will be with us to go to other levels of government and to ask for the kinds of services and the kinds of programs that we need, because they help do the financing of this. So that is an important thing. And of course, the other thing is to constantly, whenever there are programs or any kind of legislation being passed, that there be a senior lens. But I'd like to go back to the issue of health, because at the last meeting, somebody made a suggestion that hasn't been included so far in our dealings. We know that health is an important issue for seniors. We deal with their illnesses and with chronic care, things like that. But the person at the last meeting suggested, what about nutrition? The fact that they have to eat proper food. And when I look around and I see what's on the shelves in the grocery stores, the tins of food that are vegetables have too much salt in them. The tins of food that have fruit in them have too much sugar in them. And when I go to the grocery stores and I see this huge array of fruits and vegetables that are highly recommended by the health of all citizens, I know that seniors can't afford them today. When I wanted to buy an avocado for $2, I said, well, I don't think I'll buy that today. How do we make sure that the proper food is affordable for seniors? Somebody mentioned a farmer's market, which may be, that I heard for the first time today, which may be possible in the summertime. But what are we going to do the rest of the year? I see too many people buying food that has a lot of calories in it, a lot of carbohydrates to fill up, but not the nutritional food that seniors need. So I'm already thinking of what's coming forward in 2016. And I'm just delighted that out of 91 recommendations at this time, 86 have been done. And I really must commend the whole group of people that have worked on it for that. I wonder, do we get a budget for the 2016 efforts? Because so far, we should pat ourselves on the back and say, look at all the things we've done without requiring any money. But if there is a need for money to implement some of these things, I certainly hope that the councillors will consider that at budget time and make sure that not only are they going to accept the recommendations that will be forthcoming in the next month, but they will consider what has to come forward in the next 3-5 years, in my lifetime, please, so I can benefit from them. And all of you, when you reach my lifetime, will also be the beneficiaries of it, because what we want to have is an age-friendly city that not only benefits seniors, but benefits every single age group. And so I want to appreciate you for listening to me for my personal appeal as one of the older people sitting around the table today. Thank you.
Thank you very much for your comments. They're most welcome. Any questions for the deputant? Councillor Carroll.
Yes, good afternoon.
Morning.
Good morning.
I'm still there.
You're my idol. Your first concern was housing, and we do need to start building it into the budget. But I'm wondering if you would have any comment. Has the Seniors Forum sort of has this strategy cataloged, in your view, thoroughly enough what types of housing are available now, what types of housing you think work? We had a very ambitious program that was abandoned in the last term of office, and it's sort of tippy-toeing back in, but not all the way there, of building, a full sort of, we called it the campus of care, where there might be a long-term care facility for those who needed intensive care, but also some rental, seniors housing, and then maybe a private partnered lifelong lease, and have it all attached in one campus. And some of those exist. Councillor Cole was mentioning people who don't want to leave their lifetime home because basically that's their estate. But if they move into a lifelong lease, they're still hanging on to some of that money, some of that equity. Would that be a first step? Do we need to get back to that ambitious program and push that into the budget in a more robust way?
I'll just speak for myself because we haven't dealt with that specifically at the Toronto Seniors Forum. There needs to be more than one model. There isn't one model that would suit everybody. And this city is big enough to have a range of different models. And if that's one that works and it turns out to be acceptable, then we have it in more than one location. But it's up to the city people who work in this area to determine that.
Okay, thank you very much.
I do know that at Prince Charles and Bathurst Street, there is a place that was built, and it was built for seniors and disabled people, and for regular families to move in, so that the people who are the regular people would assist the disabled people and the seniors, and it works very well.
Yes.
So, that's one little model, but what you're suggesting is even a larger scope of that, a hub of sort of a variety of services that would be beneficial to all the residents living in that.
Excellent. Thank you very much.
Thank you, Councillor Carroll. Any other questions for the deputant? Councillor Cole.
I was going to ask Frances just how she was doing, but I'll do that offline.
Oh, yeah?
Yeah.
Yeah, I'm going to have an appointment with you.
Yeah, we
I've
should.
registered that already about the TTC.
Perfect.
You know what? If you'd like to ask him right now, I'll give you another 5 minutes. Actually, make that 10.
It's okay, I'd rather spend the time privately with him.
I just I just have one, well, I have a lot of questions, but I know.
Incidentally, I have a picture of you that we took together at the Downsview Services for Seniors. When you came there, it's now called Lumicare. I'm still on the board of directors there.
Great, that's fantastic.
And I have it in my album.
Oh, Well, I hope I had my hair cut that week.
Well, me too.
They're doing some remarkable work in the area, definitely. One thing that's come up when it comes to seniors, it's the food deserts, where seniors' housing is a long way from a supermarket or grocery store. And we had a situation in Ward 10, closer to Antibes Drive and Bathurst Street, where a supermarket closed down and consolidated with another supermarket owned by the same conglomerate north of Steeles.
Yes.
I mean, there's been a number of suggestions on how to alleviate that, whether it's the farmer's market, which personally, as the person who does the household shopping, I find very expensive, actually, farmer's markets, despite what they're called. But mobile food markets, the food share concept. Any ideas on how either we can bring seniors to where they could shop, the community bus concept, or food share, moving the market to pockets of seniors?
Well, why don't we put that issue on the table for 2016? Because what you've just suggested are several good ideas. The community bus is one of them. And I live in a building. It's a rental building. I have rented an apartment. I downsized from living on Ridgevale Drive. I had a 5-bedroom home, and I knew that my husband and I could no longer look after it. He's at the initial stages of Alzheimer, and we moved into an apartment building. They have a little grocery store in the building, right in the building. They don't charge the person running the store any rent because he has to make a profit, and it so happens that the charge of everything there is much greater than it would be if you went shopping, but it's very convenient. And for the seniors that live there, many of them do place their orders, and it's brought right up to their apartment room. So I don't know whether or not instituting something like that, we can be creative in terms of all these condo buildings that are going up all over the place, and the kinds of services that can be made available within the building, including, I'll add on another thing, there should be some assisted living in every single condo building that we build, and if it means going to the provincial government to get the legislation for that, that's when we need a seniors counselor to come with us and to put forward that request. Because I know that that is what we've been told when we invite the counselors to come to see us at the Toronto Seniors Forum meeting. We ask them, why are all these condos going up with no consideration for any kind of subsidized rental? And we're told, well, we have to get the legislation from the province. That's what we're told, and we believe it. So that's why we need a senior counselor looking after seniors to come with us to that level of government. And if needs going to the federal government too, why not?
Okay. Great suggestions. Any other questions? No? Thank you very much.
Thank you
for your
for
insights,
listening to me.
for attending, and your good work. Monica Baddock, volunteer, Filipino Center, Toronto, community-based researcher for the Kabalan Multicultural Center. Thank you very much for coming. There has been a handout, a research paper distributed, and I believe you'll be speaking to some of the findings in this. Great. Thank you very much. You have 5 minutes.
Great. Thank you, Chair, and good morning to the committee members. My name is Monica Baddock. I'm a recent graduate student from Ryerson and University of Toronto, and I come to speak to you today as a teacher, a community worker, a volunteer, and a community-based researcher. Today, my comments and thoughts revolve around culturally relevant and culturally specific supports for seniors. And I want to thank Councillor Cole for earlier highlighting the need to leverage cultural associations to access, inform, and empower seniors of diverse backgrounds. So I am a second-generation Filipina Canadian. My mom is a personal support worker working in long-term care facilities across the city. She has 3 positions. And many of my relatives as well work as PSWs or caregivers. Now, I mention this as some of you may know that many people working in and around supports for seniors come from the Philippines. For a variety of reasons, but they do this work proudly. But there are also quite many complications around this work. My immediate work is actually working with skilled workers from the Philippines who come here and become deprofessionalized. So previously dentists, doctors, engineers, etc., are forced into roles that are not their original training, but they do it happily to make income here in Canada. Now, in 2013, the report I've shared with the committee was a research study commissioned by the Filipino Center Toronto in collaboration with a researcher who was formerly at University of Toronto. And this particular study, called the Filipino Elderly Wellbeing Project, explored senior living for Filipino seniors here in the Greater Toronto Area. Now, what they found was quite startling. In particular, what I want to speak to today is the 70% of the fact that 70% of Filipino seniors are living in poverty, heavily relying on various forms of government support. And because we are smiley, we are friendly, and speak English well, it's one of those invisible injustices here in the city. Now, there are many Filipinos who are not yet seniors, though it is a growing population. And so for those who are working currently as caregivers supporting our current seniors, they too will have concerns in the upcoming years. Today, I want to urge the committee and actually ask around comments for their commitment in the area of culturally relevant and culturally specific supports for seniors. In speaking with Andrea and other stakeholders and members invested in this strategy, I know that they have been mindful of the development and the evolution of this strategy. But I noticed that it was largely absent in this first iteration. So as a young community organizer, I am mindful of my commitment to this area, and hope that you too also share a commitment and interest in thinking through how do we support seniors, the range of seniors, the diverse seniors of Toronto, not just the Filipino population, but more broadly. So I welcome any comments and questions around this, and I do hope that you do look at the report that is being circulated around. It's available online as well, and I can also connect the researchers and community members who worked on that project specifically. Thank you.
Great. Well, thank you very much for coming. I urge all members of council to read this substantive document. It actually references Councillor Mallow's ward, my ward, where there's a growing, vibrant Philippine community. But of course, it has its challenges. Any questions for the deputant? Councillor Carroll.
Yes, hi. I'm just looking at your paper now, and it looks at the conditions they live in their seniorhood, but I'm wondering if that research led you to go back and look at the working conditions, because so many of them are caregivers. Are there recommendations, if I go through this, for ways the public sector could help change the working conditions so that what looks like, you're a stabilizing effect in my life as a senior, in fact, you're precariously employed? Is there a way the public sector could help there?
I do want to clarify, I wasn't a researcher on this particular project. It was Roland Coloma, who was originally at University of Toronto. He's now in the States, and a couple community members from the Filipino Center Toronto. But I am aware of the recommendations, and I'm also very in touch with the range of research that's happening around the Filipino community, including the deprofessionalized and, I guess, struggling workers in various professions. Now, the report does highlight that because there is, I guess, intergenerational effects of this deprofessionalized status, and in particular those who, let's say, work for $12 or $11 an hour, as a caregiver, don't have the economic power once they become a senior, and it just becomes further exasperated and amplified in terms of challenges. Now, the report does mention some of the challenges around that, and I think as an emerging researcher myself and talking with different people committed to work with the Filipino population, it's timely that we are mobilizing now because we have separate, or I should say, detached studies on youth, on workers, on seniors, but we haven't all come to the table together to think about it a bit more comprehensively. So we're eager to not only work together as a community, but also with council members who are interested and invested in looking at this further.
So that would be a next step. Because I think, wouldn't you agree, part of the problem, I think, many seniors who have caregivers, who become a member of the family, and they might be paying for them through an agency, thinking that because I'm going through an agency, all the appropriate deductions are being taken care of, this person is going to have a pension, and in fact, anything over and above the hourly wage is going to pay the agency to be an agency. They're not actually doing anything about their seniors. That maybe came out in the research by talking to the seniors. So the next step would be to step back into their working years and work on what change needs to happen there.
I agree. Part of the challenge, though, too, I think in this particular demographic, they are grateful for the roles. So if for $12 an hour, $13 an hour, they are happily grateful to be earning that, although back home, they are doctors and dentists. And for whatever reasons, the credentialing process here makes it complicated, but nonetheless, they are eager to work in Canada, but aren't, for a variety of reasons, able to access I think, a living wage.
Right. Thank you. Those are my questions. Thank you, Mr. Chair.
Councillor Cole?
Thank you, Mr. Chair. Thank you for the presentation. ¿Cómo está acá? Mabuti? Just as an example, in Baycrest Hospital, which is in my ward, on any given day, there are 500 or 600 personal support workers, probably the vast majority Filipina women. As part of as we look at the senior strategy, I mean, do you have suggestions for us as how we can better communicate with groups like that who are giving, really frontline service, day-to-day service to the communities, how we can connect and leverage kind of their knowledge of the on-the-ground situation better than maybe we've done to date?
Earlier, you mentioned the range of associations. So many of them who are PSWs are also part of the Filipino Associations for Nursing, for teachers, and even though they don't practice, they join our associations for that social connection. And so I do believe that, I guess, having champions in the range of community organizations and cultural associations, professional associations, are crucial in terms of spreading the knowledge. My own work looks at that as well, and I found it quite meaningful because it's one thing to have a pamphlet or a brochure, but if it's not in the hands of those who can spread it in meaningful ways, it becomes documentation or paperwork that collects dust.
Yeah, okay, thank you. Thank you, Mr. Chair.
Great. Thank you, Councillor Cole. Any other questions for the deputant? Just one very brief one. Has there been any research in the community on sponsorship agreements and their longitudinal outcome? In other words, bringing seniors in from the Philippines, from a family member, extended family, making that financial commitment as what they're referring to as a sort of private sector involvement, and what the long-term success rates are of those. Do they fall apart in a couple of years, or do they have a good success rate? Has there been work in that area, or?
Personally, I'm not aware of a very direct study or research looking at this particular area, but in the report, what is mentioned is for the Filipino immigrants who came prior to 1991, many of them came as independent skilled workers. And after that, they came part of the family reunification programs. And so there, they were coming maybe as seniors or approaching the retirement age. And there you see, because they haven't been in Canada for very long in terms of contributing to pension plans or saving, this has its effects in terms of their limited financial means once they become seniors. So it is highlighted a little bit in that report, but I'm not aware of any in particular.
Okay, great. Well, thank you very much. Thank you very much for that document. Appreciate you coming in. All right, well, that finishes off the deputants and the presentation. It's questions for staff. Visiting councillors, questions for staff? Councillor Carroll.
Yes, it's around the housing question. I got to get back to, I had the document online here. I'm looking at there's a sort of a catalog in here of things to do, but I do note that the deputants from the Seniors Forum have noted that they haven't really turned their minds in the Seniors Forum yet to really cataloging, these are all the housing types and this is what works for us and what doesn't work for us. Is that work happening now through staff, through the strategy?
Through the chair, there are a number of exciting initiatives going on right now. We are working with Toronto Central Lynn, who's actually in the room today. And so where we provide housing allowances and they provide health supports, we're starting to work together to try to figure out how to serve the most vulnerable Torontonians better by aligning our supports.
So will that lead us back to the original Campus of Care, BAFO, ambitious program, or are we heading back in that direction?
Generally speaking, through the chair, yes, we are. I believe there are a number of conversations happening within the city, with the city and provincial colleagues around more integrated human service delivery generally. Right. And at the same time, there is a provincial initiative looking at the development of community service hubs, which is a form of integrated service delivery. So on a number of fronts, this conversation is moving forward. Is there a specific initiative in place? Not yet.
There isn't, so it's not really back in place yet. So we can't even say that we've got it in the out years of a capital program. We need to restart that program.
Well, Council did consider George Street revitalization, which is a form or an example of a different service delivery approach to integrate a continuum of housing for a particular population in place.
Okay. Thank you. Those are my questions.
Thank you, Councillor Carroll. Any other questions for staff? Councillor Fletcher?
I think, is somebody here from transportation staff? Oh, good morning. I was describing to one of the deputants about difficulties that seniors have, particularly second language speakers, when they're arriving at, or second language readers, arriving at the crossing, which they have to push in order to have a safe crossing. And I understand that transportation staff have said that you will not change that to facilitate the crossing of the street by seniors. Is that correct?
Councillor, I'm not aware of that statement, but I do know that we are reviewing our pedestrian signal policies, and that is definitely one of the ones that we want to review. Whether that changes, these are these actuated signals where somebody has to press the button. That is usually the case where there's a fairly low volume of pedestrians and they're attempting to cross what is usually an arterial or a collector road. And so we're looking at that, whether it is something that can be informed, changing it either within what we might describe as just high-volume areas, so for example, the downtown, or where we can begin to identify communities that would more readily benefit from this, even though the numbers might be low. For example, proximate to senior centers or community centers, or as you identify where language issues might be an impediment as well.
So if those are identified to you, you have the ability to override the policy, is that right?
I think
General manager
it's
does?
perhaps more fair to say that what we're doing is reviewing the policy and trying to integrate all of those considerations so that it's updated to reflect how our city is changing and shifting.
But what my question is does the general manager have the right to, on the basis of a seniors home nearby with perhaps a lot of second language speakers, override the policy that it will always, the button always has to be pressed?
Yes, the general manager has the right to change the types of signals that are in place based on operational considerations.
Okay. And when cars come up to one of these ones, and we all know them, it's a pedestrian countdown that's counting down, and you think it's going to red, and then it flips back to the walk sign because there are no cars at that intersection, and there are sensors under the intersections that indicate that there's a car there, so that's when the light actually changes. Is there any possibility to do that in certain sidewalks in certain areas so that it indicates there's pedestrians on the sidewalk we're waiting to cross?
Right. It's a very good question. We are looking at new technologies to do so. Unfortunately, the ones that are embedded in the sidewalk are either hypersensitive or not sufficiently so. So, bicycles or dogs might pick it up. So the thing that we think holds great potential is video detection. Some of the challenges are winter conditions, so it is something that we're investigating.
And then the other with the sign that the deputant showed with Arlington where, it's very unclear. Is there some reason why those numbers were deleted, or when street signs are being developed that there's not a policy to include the address? So when you are navigating through a neighborhood, perhaps going to a specialist doctor or going somewhere you haven't been before, and you know the address, it's much easier to get there.
It's a very good point. I don't know the specifics about why that decision was made, Councillor. I can find out and get back to you. I think the generic issues are that when we're trying to develop these signs, we want the lettering to be as high and conspicuous as possible, and some concerns about clutter on signs, but I can get back to you about the numbering.
Are those the old Metro signs that you're showing? It's the old Metro sign? Compared to the city sign?
I'm not aware of whether those are the old Metro signs or not.
The old Metro template. Okay, thank you.
Thank you, Councillor Fletcher. Any other questions before I ask a couple of quick ones? No? Just through me to transportation, to follow up on some of the questions regarding sidewalk snow removal or street clearing in high concentration of seniors. This is something we've been grappling with for some time. What are the current resources allocated to that, to ensure, or programs under our strategy to make sure that seniors are not trapped in their apartments or homes during extreme weather incidents or in fact regular winter periods?
Okay, an excellent question. The city has revised its snow removal standards. Firstly, we have opportunities for seniors to have their sidewalks cleared. They are so too for those who have disabilities. And that is a program that the city manages. It costs approximately $1.1 million. And seniors can do so by contacting 311 and they'll get the necessary information. We've also looked to improve our sidewalk clearing program, specifically on what we identify as high pedestrian areas. So along our arterials, transit routes, collector routes, We will be looking at clearing snow as soon as it hits 2 centimeters in accumulation and trying to do so on an expedited basis, particularly along our arterials. So we don't yet have the sensitivity that you're describing, Councillor, which is identifying specific population types. We are looking primarily at population numbers at this point. This is, I will also say, the first year of this contract. It is a multi-year contract, so we look to further refine it with inputs from the community so that we can get better at targeting those high-profile areas and where the need is the greatest.
Is this designed as sort of a snow removal SWAT team that runs around? We have the monies to pilot it and launch it, to go to those areas that we've sort of targeted as high concentration or high needs?
It's less a SWAT team and more a new program where we're beginning to identify the need to walk safely and tackle these maintenance issues for pedestrians as we have done so previously for vehicles.
Thank you. It's good to know. I hope other councillors took note of that. Just very quickly, Food Share, which is a City of Toronto partner, doing a mobile food market in Ward 10. From all indications, anecdotally, it looks very successful. What are the prospects of expanding that and making that work, and whether it's a cost recovery model or how is it backstopped financially?
Through you, Mr. Chair, I think at this point we don't have any clear information on expansion, but that would be something that we would be looking into in terms of models that are working effectively in community, supporting seniors, and how we can support them moving forward.
Okay, so a little more work on that. Great, thank you very much. Any other questions? Let's go to a speakers list. Oh, questions or speakers list? Councillor Matlow, to speak.
Well, I want to, really most of what I want to say is to express a lot of gratitude to a number of people who've been a part of this strategy. First and foremost, I want to thank my colleagues. When I brought this motion to initiate the strategy soon after the 2010 election, 2011, at a time where council was arguably at its most divided, and it was, I think it's fair to say, a very difficult moment in our history. There was a unanimous vote of support for moving forward with the senior strategy for the City of Toronto. And I think it really speaks for our collective values. Since then, we brought this to the hands of our very competent staff to implement our strategy. And as I've said in many audiences before, but I want to say it before you because it's important that you know the kind of work that our staff do. You know, we often ask our staff to do things, and sometimes they do it, you know, excitedly, and sometimes they do it admittedly begrudgingly. But in this case, it was done with a complete labor of love. And I want to acknowledge Andrea Austin, first and foremost. She has been passionate and competent and focused and determined. And I deeply respect you, Andrea, and I really appreciate the work you've done. Along with Denise Campbell, who I could say a million wonderful things about as well, and Chris Brillinger, you know, and while I'm at it, you know, Kelly Murphy and the whole team at Social Development, I must say, all of you really understand how to make government work for the people. One of the wonderful things about this strategy, and I've had an opportunity to work closely with this team on the SPIDER program that you're going to hear about and a couple of items to deal with compulsive problem hoarding, and also our youth equity strategy. One of the wonderful things about these strategies is that we have accountability measures, the youth equity and this as well, that it's not just about making promises and making commitments that we can cut ribbons about, but having the ability to then follow up and see what we've done and then admit what we haven't done enough on, so that we don't make the same mistakes of the past. When we first started working on this strategy, one of the first things we looked into is why didn't all the other great initiatives that was done before us, why didn't they really get implemented as far as they should have? And the answer is that A, governments don't work well together, and often they either work in conflict or in competition, or nobody wants to sign a check, or nobody wants to bring any of the allowances or money to the table. We made sure that we had a strategy that focused on A, what can we do without new resources? And we did it really, in a lean but focused way, through an age-friendly lens, through all the work we're doing as a collective organization. We also looked at what do we need more budgets for? What should we ask for? What are reasonable asks for? And then also, how can we work with other levels of government? And I want to, at that point, thank Dr. Samir Sinha, who he's the head of geriatrics at Mount Sinai. He is globally renowned as an expert in this field. He helped lead the provincial senior strategy, and he has been an incredibly important partner in our success thus far and moving forward. And I just want to compliment you, sir, and thank you very much for the knowledge and expertise and charm that I believe you bring to the work that we've been doing. And I also want to thank our expert panel and accountability committee. Without your expertise and your knowledge, but also holding our feet to the fire, telling us when we need to do more, telling us that we haven't done the right thing, but also giving appropriate kudos to when we have, means that we will continue moving forward, and I encourage you to continue doing the work that you're doing. All the different organizations, individuals, agencies, city staff who have been at the table from cross-divisional, breaking silos, all of you are part of a team that's leading to an incredibly important initiative. And, this is the kind of strategy, and, there were no articles written about this when this was approved. There were no columns, no comments, in any, big public forums, and there probably won't be today. But this is one of the most, in my opinion, the most substantive, deeply important types of work that we can do, because we're creating a city that is not only seniors friendly, but friendly for young moms and dads who are pushing strollers, for people who might be in wheelchairs or any other type of disabilities that they're challenged with, and everyone in between. And I know my time is up, so I'll simply conclude by just expressing my deepest and most heartfelt gratitude to every single one of you who are in this room and outside of this room who have contributed to this strategy. And I'm grateful to this committee. I'm going to hopefully assume that you will support the recommendations with flying colors. Thank you.
Great. Thank you, Councillor Matlow. And I know that you should be given a lot of thanks and credit for your commitment and devotion to this initiative, which is really quite a remarkable document. So thank you. Councillor Carroll.
Yes, I second that. We have to thank Councillor Matlow because the deputants thanked him, so we got to join in. But I too want to thank the deputants, and I was very pleased to hear the word participatory coming from our deputants. I think that's the reason we've got as far as we have without energetic funding for this initiative, because it was done in a very participatory fashion, and so we're getting the feedback from the people we need to. I do want to highlight, though, that to continue in that vein, I think the next step in terms of housing, we have a tendency to just struggle with what we know to be, possible encouraging signs from the other orders of government, and so let's go here. But I really think we want to go back and sit down and actually talk with the forum and other seniors groups on what housing types work and why they work and what would make them work better. Frances Chapkin, I think, encapsulated all the deputants' thoughts when she talked about it has to be a range. And so I think we need to discuss the range. I know in my own, I mentioned the campus of care and maybe looking at them being more possible to fund the range if you included them in a not-for-profit or private partner doing a lifelong lease attached to that, because we do have many seniors who want to stay in their home to hang on to their equity, but that in and of itself is what's making them vulnerable. And so looking at the full range of models and then coming back into our building to talk about what are the funding models that would make those housing models possible is very important. But we heard talk about food as well. And I think we want to remember what our seniors have told us about food, the inability to afford fresh produce. We're doing that work in other places, but we forget that we're in fact doing it for seniors as well as some of our other more vulnerable young families. We have a hard time getting councillors to volunteer for the Agriculture Committee, the GTA Agriculture Committee. But in fact, work there actually is going to making that very food more affordable. We would like to see food manufacturers and food retailers doing whole crop purchasing. That's why vegetables are expensive, because people won't buy whole crops of vegetables. They go to the farm and pick just the straight asparagus that's exactly the right shade of green, and I'm sorry, I'm not buying the rest. You'll have to throw it out. So they don't grow asparagus. We need 20% cereals in our diet, and yet around the world, 49% of the food that is grown is cereals. You're growing the wrong food, because when you grow cereals, people do buy the whole crop. If you grow vegetables, they don't buy the whole crop. So that's a crazy concept, but here we heard today it actually helps seniors as well as everyone else if we get the right foods being grown. You're going to see an executive of food waste motion. That's really offering something up to businesses only to open the collaboration between them and the public sector and the health sector to where we can then begin to get producers and retailers to also work with us on growing and selling the right proportions of the right foods. And it is a senior's lens to make sure that that happens. And you'll get to do that in just a few days. The reason I talk about seniors and young families in the same breath is we have a looming crisis. Seniors today are being helped along by baby boomers. The millennial generation, folks born in 1993, actually represents a bigger demographic bulge, but the difference between them and us is they're all precariously employed. Almost all precariously employed. They don't get benefits. They don't stay in the same job for 30 years. We say it's because they don't want to. No, it's because it actually isn't available to them. We know that for a fact. And so we're heading towards a crisis where at the very time we need them to be feeding into the economy enough money to house seniors, they won't even be able to house themselves. And that's why it was very, very key to me that all the deputies said, number one is housing. We have to solve their housing, because although we have a new bulge in the workforce coming, they're not going to be generating the public sector funds to build the housing. We have to start now. So I applaud that is so highlighted in the strategy. I just hope that we can actually put some funding to it within this term of office.
Thank you, Councillor Carroll. Any other speakers? You have a few motions.
They're not quite ready. So if you were
Any other speakers? I'll just share a few words if, while we're waiting for those motions to be written up. This is one of the most vital conversations any city, any society can have. The age quake from any statistical vantage point is real. And prior to coming on to City Council, I was working as part of the communications and advocacy team at CARP, Canada's Association for the 50+, where we studied a wide range of public policy issues of all three governments on how those can be improved to make lives easier for our aging population. And our aging when we talk about what those areas are, we want to make sure that as a society, we will be judged on how we treat our aging population. And it comes down to some of those key themes, those macro themes, like financial security, security of housing, access to affordable food and health care, certainly personal safety in the crime prevention area, and knowing that you have not been forgotten and you have not been marginalized. And I think more and more elected officials with aging parents are realizing the great challenges that we face. And there will be one day where our signs will long be recycled, where we'll no longer be sitting on council. The mayor's office will no longer be calling, and we'll have long left our job in this building. And certainly we want to be treated by society in a dignified and respectful manner. And it's our responsibility while here to make sure that we put in place as many of the key public policy initiatives that we can. At the same time, we do face challenges in pushing other levels of government to see policymaking through a senior's lens. And although many policies and programs are well-intentioned, they sometimes have consequences that are somewhat unexpected. Certainly when it comes to the sponsorship agreements where and family reunification, where we're bringing in seniors on those sponsorship agreements to Canada, and that the sustainability of those agreements is at risk as the long-term ability of the sponsors to pay becomes weakened over time. And I can tell you that many of those the consequences of those failed agreements come to my office, my constituency office, and we meet with many of them. And that is just about one example. Another one, certainly, which is a common theme and touched on by Councillor Carroll, is the housing area. And I can tell you that seniors do not want to wait 15 years to join a waiting list of 75,000 to get on for a building to be built sometime in the future. We must be looking more and more at a more robust rent supplement agreement strategy and a housing allowance agreement, because the need is now, the need is real, and the last thing we should be doing is making pie in the sky promises on capital projects and buildings that are 20 years hence. So with that being said, I would just summarize by thanking all the team that worked on this document. It is a living document. It's an evolving document. It will overlap on other things we're doing at the city, including the poverty reduction strategy. Certainly, Andrea Austin is to be thanked, Chris Bellinger and Denise, and once again, Councillor Matlow. I look forward to this document coming back here again, where we can continue to benchmark and measure its success, and look forward to hearing from various organizations and deputants on what we were doing right, and certainly where we can make improvements. So thank you very much. Have we got those motions ready?
Yes, I am ready.
Councillor Fletcher.
Thank you. I'll start with the motion C. Oh, you've got motion A. All right, we'll go with there. That just has to do with community dining. I think it's a very, very exciting idea, and was very happy to hear that there was some. So that's that motion, the benefits of community dining, what the operation of New York City model looks like, and where do we have some of those in Toronto. The next motion is to look at those intersections that don't work with automatic pedestrian signals, which are close to seniors' homes, because I think that's a very big one. There might not be that many, but if we have the ability to move on those, we should. And the last one is, after hearing from all of the deputants about what a fantastic job Councillor Matlow is doing, that they want a seniors advocate, I think we should support having a seniors advocate for the City of Toronto, particularly with this tremendous report. So I think it's just great, the work that has been done here, the very strong, what I'll call integrated model across all of the divisions, and the opportunities to look at some new and exciting things. I happen to think community dining is very exciting for the reasons that our deputants referred to, particularly around social isolation, community building, identification of any types of health issues or anything else, that we have the ability to have somebody there rather than going individually to each person. Isolation is a very big thing with seniors. I have a large number of seniors buildings in my ward, and all opportunities that we can undertake easily and effectively to have seniors have a integrated social experience, to eat good food, including the good food markets that Councillor Pasternak has talked about as being very effective, although it might be a bit expensive, but partnering with people that do food. We run so many programs in schools for children's food. They're already there. The Premier has said, create community hubs. We just heard Karen Petrie at Ralph Thornton Centre on Monday morning talking about community hubs to develop those. Would we not have a layer around seniors and particularly community dining? There are real opportunities to open up, think outside the box, and do things that would be, I think, groundbreaking. And the facilities are there, the ideas are there, the partners are there. I have no idea what the money situation is, but we would at least identify some opportunities and then where some of the funding opportunities would be. I happened to sit on Toronto Community Housing when Al Gosling died because the staff insisted that he fill out his paperwork for his income taxes, and he was a bit defiant and said he didn't need to, that they already had that on file. And every year seniors had to fill this out over and over and over again, and this guy lived alone. He didn't want to do that, and he ended up in the hallway and then dying at the hospital because he had been evicted for that. That had a big effect on me and many others. It led the Ombudsman to insist that Toronto Community Housing have a fairness commissioner around evictions with special attention to seniors. We are trying to pay special attention to vulnerable seniors, and I think that's great. This report pays special attention to all seniors as a cohort. How can we now be creative and do exciting things in order to meet the, what did you call it? The age quake? The age quake. The large number of people that are finding themselves in this situation, all the issues that go along with it. And I think having a seniors advocate is a brilliant idea. I think you're very smart out there for figuring out you need a good champion at City Hall and on City Council. So with that, I hope the committee supports that recommendation. Thank you.
Great, thank you very much, Councillor Fletcher. Any questions for the mover? Any other speakers? Can we take it as a package? Motions A, B, and C. All those in favor? Opposed? It's carried. And the item is amended. All those in favor? Carried unanimously. Great, well, thank you very much. Item 8.2, I was the one who held it down, and the reason I held it down is it's a lot of money. And I'm just wondering whether we could I'll go to questions for staff right away. I'm just wondering whether you could take a couple of minutes and explain how the bidding process worked, and whether we're getting good value for what looks like a $20 million price tag here.
Through you, Mr. Chair, to you, Mr. Chair. So this was a fair and open RFP process for a highly specialized piece of equipment that we use in paramedic services. There is a very small number of manufacturers that actually produce this type of equipment. So there were only 2 manufacturers that actually formally bid. We did engage a fairness monitor to make sure that all aspects of the process were done in the proper way. And also PMMD, or purchasing, led that process in conjunction with us and City Legal. So all pieces of the process were done correctly. In terms of value for money, these are very expensive pieces of equipment. This is over a long period of time. That's why it adds up to such a large number. But because we buy so many monitor defibrillators, compared to other jurisdictions, we do get them at a much lower cost per unit than places that would be buying 1 or 2 of these things.
This is a 10-year or 9-year program, it looks like. It rolls out through to 2025.
That's correct, but the way we've set it up is that they're 1-year options. So we'll be monitoring the industry and looking for changes in technology and those types of things, so that we have the option at any time of doing a new RFP if new technology comes out where the equipment would be better or cheaper. And typically with this piece of equipment, they typically run on a 5 to 10-year life cycle. That's what we've seen in the past with this equipment that we've used.
Mm-hmm. Also in the motion before us, we're delegating authority to staff to exercise those options.
That's correct.
Is there, you don't feel a need to come back, or you?
No, I don't think we feel the need to come back. We do that with our large purchases, whether it's vehicles or other specialized equipment within paramedic services currently.
If the options are not exercised, would you come back to committee and give us a little bit of an update on why they're not, if there's anything problematic as we go forward?
If we chose to go back out to a new RFP, then it would be a new process, and that would absolutely come back through committee.
Okay. All right. Thank you very much.
Thank you.
Any other questions for staff? Okay. Move the recommendations. Have someone to move the recommendations? Councillor Burnside, all those in favor? It's carried. Thank you very much. Okay, we're on item 3, specialized program for interdivisional enhanced responsiveness. We do have a deputant, Laurie Lucier, Toronto Central Lynn. Thank you very much for coming. You have 5 minutes.
Thank you, Mr. Chair and members of the committee, for the opportunity to share with you the Toronto Central Lynn's support for the progress made to date by the city through the efforts of the Spider Table. As you mentioned, my name is Laurie Lucier. I'm a senior consultant at the Toronto Central Local Health Integration Network, also known as the LHIN. You may know that the LHIN's role is to plan, fund, and integrate the local health system, which includes hospitals, long-term care facilities, community health centers, home and community services, as well as community mental health and addiction services. While our mandate relates to all residents in our catchment, over the last number of years, the LHIN has actively been pursuing interventions, system improvements, and partnerships that are aimed at improving the health of many of the city's most marginalized citizens. Citizens very much like the individuals that have come to the attention of the Spider Table. Through our work, we've recognized the value and effectiveness of coordination of services within and across sectors. To that end, we very much support the efforts of the city to create opportunities through Spider to strengthen the dialogue across city departments and to enhance the connection between city services and other community health and social services. These are important advances. This approach is aligned with the TC Lins approach and complements efforts underway in health to identify and address the healthcare needs of the most complex patients, what we call in health call the HealthLinks program. Similar to SPIDER, HealthLink offers a forum for health providers to discuss not only a response to challenging situations faced by people with multiple health conditions, but also assists us in identifying issues that require changes to the way we deliver service, the way we partner or integrate systems. These types of conversations have a significant impact both on the individuals who will get coordinated and organized care to improve their health, but also noteworthy system impact. These practical collaborative discussions, whether they are across departments, across services, or across systems, can lead to important improvements in the way we organize and deliver services to our shared population. From a broader perspective, the Toronto Central LHIN, through our new strategic plan, aims to deliver on a healthier Toronto, ensuring that residents have the services they need to improve their health, all residents. We intend to do this by taking a population health approach, focusing on characteristics of sub-LHIN populations, understanding their unique needs and challenges, and working within communities to find sustainable solutions. We're applying a health equity lens to ensure that everyone has a fair chance to achieve optimal health, and we recognize that vulnerable people in particular may need additional supports and unique responses to their complex issues and situations. We believe that health services are not only one factor not the only factor in determining one's health. Equally important are the social determinants, including safe and affordable housing, connection to community, food and income security, and freedom from stigma and discrimination. If we are to reach our goals in the health system, we will require continued strategic partnerships within health and with other key partners, including the City of Toronto, to address the context within which people are living and receiving services. We are encouraged by the emerging partnership between the City of Toronto and the TC LHIN and see the SPIDER initiative as a symbol of the potential to collaborate together for the benefit of the populations that we serve. As the staff report has suggested, many of the residents who have been assisted through the SPIDER process have often needed health services to respond to the situation, mental health services in particular. Health service providers involved in the SPIDER table have reported value in participating at the table and feel that while it will continue to evolve and mature, it is an effective table to support collaboration and problem solving. TC LHIN would like to congratulate staff and members of the SPIDER committee for their successes to date, and we hope to continue to discuss opportunities to align LHIN work and the SPIDER initiative moving forward. We look forward to continued collaboration to improve service delivery and health outcomes for residents in the city, and we'd urge Council to continue to support this important work. Thank you.
Great, thank you very much. Questions for the deputant? Okay, great. Well, thank you very much for coming in. Questions for staff? Councillor Wong-Tam?
Yes, thank you very much. A few questions around the report, and just largely to seek clarity based on its sort of second unveiling now at this committee. The definitions around the language resolved and risk are unclear, and many of the vulnerable residents who could be left behind because of lack of clarity in these definitions. What is the threshold for a vulnerable resident meeting risk, and according to SPIDER?
Through the chair, the threshold definition of elevated risk refers to compelling circumstances contributing to a serious threat of physical or psychological harm. It has been an evolving process in terms of honing in on the definition, and that's an element of the program that we continue to focus on.
Is there a way for us to expand the definition of risk so that a broader range of complex cases or conditions can be addressed through the integrated efforts of SPIDER?
That's certainly something we can look at as the program continues to evolve. We do, the caution is, or the other side of this, is that SPIDER not be seen as a replacement of existing program interventions. So we have to keep the threshold fairly high in order to make the most effective use of this kind of intervention.
So if the spider situation table currently, I mean, as it stands right now, I understand that it does not include counselors or perhaps their political staff. It's oftentimes counselors and their political staff that are dealing directly with the general public. We're oftentimes the people that interface with the vulnerable population, and at this point in time, there is no opportunity for us to make that recommendation to have their situations or perhaps a case analyzed or being dealt with by Spider. And it's also a point that even in the Ombudsman's report has said, you know, counselors have been oftentimes that front line of communication. How can Spider be improved to include and support counselors and their staff when we're trying to respond to the immediate needs of the vulnerable Torontonian or the population that is vulnerable?
There's a number of issues involved in the question. First of all, we have to be incredibly careful about privacy concerns. So the protocols, the approach to privacy around the table is very significant, and we have to observe all of the legislation. That being said, we are fully aware of the sensitivities that counselors and their staff are faced with every day in terms of these situations. We are happy to work with counselors to help in navigating or trying to secure the best resources against a particular situation. At this point, Councillor, I would recommend that Council allow us to continue to develop the program. We're not yet ready to expand the mandate. We will certainly review that and report back.
There's a briefing note contained that refers to 43 cases that were brought to the situation table, and that 23 of those 43 were resolved. What became of the 16 cases that were unresolved? And how do you deem a case unresolved and resolved? And what do you do with the unresolved cases? Do they just continue to remain unresolved? Or do you work to a resolution? Trying to find how do you close that gap?
Those situations remain open at the situation table, and we look for various interventions to be able to respond to the needs. Sometimes those interventions are lengthy because they involve court processes or other service systems. So with some of the situations that remain open, it's because there's multiple interventions happening in those situations.
Do you put a time limit on it?
There's no time limit. The purpose of the table is to respond as immediately as possible and build off of what is the knowledge base amongst a collective of service providers and leverage that to create new opportunities to provide service to the vulnerable individuals in these
So from our own experience of working in the ward on a couple of cases, there seems to be divisions and agencies that are relying on different definitions of problematic hoarding. Can a definition around problematic hoarding be expanded to include the continuum of the hoarding situations? Because everyone's using a slightly different marker.
Again, that is one of those definitions that we are working through. The SPIDER program has a broader mandate than just hoarding or hoarders. And we are working with the healthcare system, as you just heard, and community service providers to work through those definitions. In terms of the length of time that it takes to close some situations, these are incredibly complex, intractable situations that have often been in place for many, many years. So the table and all of the services involved take the time necessary to resolve the situation appropriately.
So knowing that the Mental Health Act plays a vital role in guiding how we interpret the service and how we deliver that service, are the provincial partners at the table to address the gaps between what the city needs, what the city services are, and the Mental Health Act?
In fact, that's one of the innovations of the table. You heard from the Local Health Integration Network, which is the provincial health delivery arm in the local community. We have the Office of the Public Guardian now at the table. That has been years in the work to fully engage Office of Public Guardian. And we also continue to work with provincial colleagues in the Ministry of Community Safety and Correctional Services.
Okay, thank you. I'd like to continue asking questions, but I realize I'm 7 minutes into my questions. I don't want to to abuse this process here. Yeah, thank you. I also don't want to monopolize this.
Yes, no, I...
I'm self-monitoring.
Yeah, no,
This is a level of self-awareness that all councillors should have, I think.
You can certainly bank those minutes for the future. Councillor Carroll.
To comfort Councillor Wong Tam, I think they're all sort of follow on, so we'll probably go in a circle and come back. I'm looking at, I'm pleased to see, we're still struggling to figure out how we work with this. The one thing that worries me is I don't see a lot of work on working on how we can comfort and help the community around the Spider case. Once you have a case, generally it's also the case that the entire community surrounding them is now either up in arms or very concerned, and whether they're being whether they're sympathetic about it or not, they need a certain amount of information to understand that the city is at work. Is there work being done as we deal with these initial cases to understand what information is fair to give to a community, protects the individual being served, but gives them enough comfort to let them just sort of settle back and let the city do their work?
Through the chair, to be absolutely clear on this point, without individual consent, we can release nothing.
Right.
So I need to be very, very clear. The whole issue of personal information is central to the Spider Initiative.
Right.
That's really the nut we've cracked through this program. And we have to be incredibly careful. In fact, we are working with the Privacy Office now to see how we can better ensure or absolutely ensure that privacy legislation is observed. So
you're working with them on the protection of privacy, but how do we combat? We end up with, and I hate to use this word because it might be seen in the wrong light, but there's a meddlesomeness that can happen when you arrive to respond. Simply because you have a frustrated community who thinks we're not doing anything at all. So the day you come to try and discreetly do your work, you're set upon by a neighborhood mob. How do we get them to just stand back and let you do your work? What can we say to them that allows us to comfort them enough to have them go home, let us deal with this?
In some of the Spider situations that we've been responding to, we're looking at the scope of the entire situation, and that would include the risks and health and safety risks to not only the vulnerable individual, their property, but also the neighbors, so the community. So if there's risks involving the wider community, we would factor that in. We're also working as part of the response in leveraging all of our tools and mandates, including strategic communications, so to help craft messaging that can be shared with the public about what city actions may or may be in situations. So we
While
really have
still protecting the
yeah, at all costs, protecting the privacy and of the individual and the situation.
Okay, thank you. Those are my questions, Mr. Chair.
Thank you, Councillor Carroll. Councillor Matlow. Oh, speakers? Any other questions for staff? No? Let's go to speakers list. Councillor Matlow?
Well, so I want to say some very positive things about this initiative, but also be very candid about the primary thing that we're missing here. which frankly is just not under our purview, as are many issues that we contend with at the city, that frustratingly we sort of hope and pray that the province will turn their attention to as a priority. So first of all, compulsive problem hoarding is an issue that has been around for a long time, although not recognized well enough until recently. It is in virtually every neighborhood in our city, in our country, across the continent, and perhaps around the world. There are some neighborhoods and buildings where there are multiple cases of problem hoarding, yet there hasn't been enough attention turned to it. And I brought motions last term to start kind of the ball rolling on trying to get a more comprehensive approach to this problem, like is done in Kingston and other jurisdictions. And through the good work of staff, SPIDER, I think, is a great success story with respect to how government should run. Ultimately, we shouldn't be having various silos pointing fingers at each other or saying, I don't have the ability, or I don't have the allowance, or I don't have the law behind me to be able to enter a property or do this and that or clean up the outside. It's somebody else's responsibility. For the first time, we have everyone at the same table. And that is critically important when whether a councillor or a member of the public has a specific challenge with the problem hoarder in the community that is having an effect on the quality of life, property value of neighbors, having sometimes horrific consequences for animals that can be found on the property, but also, and should never be forgotten, the hoarder, him or herself. And it's incredibly important that we work together comprehensively, and that's what SPIDER is about. And I'm very proud of that. I'm very proud of the work that we as a city has done on that. But here's the problem. I've also moved motions asking about working with the province to reform the Mental Health Act. The criteria for, when an individual is being considered for being formed, it is not very difficult to demonstrate competency to take care of him or herself. And I have one example, and I know all of you do too. I know there are horrible stories at 200 Wellesley, for example, in Councillor Wong Tam's ward, and there are examples in every one of our wards, I believe. But on one street in my ward alone, there were two problem hoarding, compulsive hoarding situations. One up the street where between 60 and 100 cats were found in the most awful, awful conditions. But the hoarder herself was a college professor during the day, was living what would seem to be ostensibly a functional life, but then would come home to a place without running water and electricity. The other situation I'm dealing with right now, you have somebody who inherited a property from his mother, who is not able to take care of himself well. When we were actually able to take unprecedented steps for the safety of the neighbors in the community to get in there and clean it out and even board up the house, he lived outside in minus 20-degree weather often on his front porch. How could any reasonable person suggest that this individual has the competency to take care of himself? So no matter what we do at the city, and I'm very proud of what we're doing at the city, we don't have the tools at the City of Toronto, which is a piece of paper, a piece of legislation called the City of Toronto Act. We don't have the tools to be able to adequately deal with this because it becomes a vicious cycle. You can clean up the property outside, you can clear out the inside to make it safer. You can even look at the mold. You can take out the flammable pieces of paper. But if that individual doesn't get the mental health care that he or she needs, it's a vicious cycle. He or she will continue to return and continue to return and continue to return even if they're living outside in the case of an individual in my ward. So I say with great optimism that I'm delighted that we finally have a silo-breaking SPIDER initiative. We need this team to be able to do our work as well as we can, to mitigate the problem. But until we have genuine reforms to the Mental Health Act, this problem will continue, and we need to work with the provincial government to do that. The last thing I wanted to say is that I just got news right before I was about to speak that this individual who I was talking about, we thought that we had actually arrived at a solution. We thought that was going to come today, and then I just found out that because of the issues that I just raised and the litigious process, which is entirely imperfect, the problem has not been solved. This has dragged on for over 15 years. And I'm personal friends now with the young family with 2 young children, one of which was born in that house, which is a semi-detached with this hoarder who needs care himself, but unintentionally is having an effect on this young family where they were not able to have family over when their kids were born, that they have mold growing in their house, that they have ammonia and smells that are just inhumane, and this just can't go on this way. So again, I congratulate us for the great work we've done, but until real reform is made, we're not going to be able to make progress.
Thank you, Councillor Matlow. Councillor Fletcher.
Thank you very much. I'm just going to follow up on Councillor Matlow.
Oh,
Pardon? Oh.
sorry.
about that. I was speaking.
I thought you were, it looked like almost like a point of order you were going to make or a suggestion. Sorry. Councillor Wong Tam, please.
Thank you very much, Mr. Chair, and as a visiting councillor, I appreciate the opportunity to speak. I'm going to place a motion onto the screen, and hopefully we can have one of the members take carriage of this motion. It's a 3-part motion, and largely to hopefully enhance the SPIDER program and to see if we can expand its scope of work and to sort of modify the program so it can actually do more than it's doing right now. And if I can just take a little bit of time to explain what this motion will do, is largely number 1 is to lower the threshold for residents who qualify to have their cases reviewed and resolved by SPIDER. And this can be done with under the supervision of the Executive Director of Social Development Finance, as well as MLS and the Medical Officer of Health. Currently, SPIDER does not meet the needs of all those conditions, all those circumstances, and I think there is the in-between of those situations that get lost in the gap, and they continue to be lost in the gap. So that's number 1. See if you can expand the scope and to lower the threshold. And 2 is to allow the city. Number 2 is to permit city councilors and their staff to refer cases to SPIDER. You can determine whether or not these cases do qualify. But the fact that city councilors in this particular time are oftentimes the first point of contact for the residents who are impacted, for the neighborhoods that are impacted, I think it would be absolutely ridiculous to not allow us to at least refer you to that property or that vulnerable person who needs assistance. And the third amendment is to ensure that there is a very clear communication strategy between what SPIDER does and what the councillors need to know. Because I bet you anything that if you canvass the 45 members of council, you're going to have a range of opinions of what is SPIDER. And right now it is not clear. Councillors do not know that this program exists, and I think there has to be a clearer communication strategy to explain what SPIDER does and to ensure that that all service providers, including councillors and their political staff, are aware of this particular program. Now, if I can just speak to some situations that we have seen in the ward, and it's not going to be very different than situations that you have also had experiences with your own individual wards. Councillor Matlow, I think, articulated some of the impacts that we have. We have spent an extraordinary amount of time trying to assist individuals who really do need assistance. When you have professionals walking into a property with a hazmat suit to help clear the home of particular debris and hoarding, to ask residents and neighbors of the community by giving them cat traps to trap the cats to get them fixed and provide medical attention for the cats. You cannot tell me that the person who's actually residing in the home is going to be able to take care of themselves solely. So what we want to do is make sure that the individual who requires the assistance gets the assistance that they need. And there are going to be folks who are going to be able to function and probably run about their daily business in a way that does not lead us to think that they're not living in unsafe conditions. But the fact that they are hoarding and they have 20, 40 cats in their homes also should tell us is that there is someone who's not able to take care of the situation at hand. So what happens is that you have an environment that brings us in as city councilors and brings us in as staff who work with the councilors, who then reach out to MLS. Then we reach out to our bylaw officers. Then we reach out to Toronto Fire. Then we reach out to Public Health. We are reaching out to every single division, asking them to come and help that individual. So we are in many ways the original conveners trying to coordinate the service that should be coordinated by the City of Toronto. And we should be doing this with the province, because some of this is around mental health. It's about their own situations in the home. And we're not trying to impede on anyone's rights, but there has to be a better way of coordinating the service so it's actually more effective. The fact that you have 43 cases that have been brought to your attention, and only brought to your attention by those who are divisional and the staff, 23 of those cases deemed to be resolved, and 16 cases that you deem as unresolved, I can probably assure you that there are many more cases that we can refer to you, and then you can determine whether or not they qualify for the SPIDER program, if it needs to be worked through the situation table.
Wrap
But
up.
if we don't do this work, you're only going to go back to what was set up as an initial pilot, and the pilot is only being asked to continue doing what it's doing. And there is nothing in the report, as I can see it, that expands that scope of work, and we know that there are people who are falling through the gaps that SPIDER is not assisting. Thank you. And thank you for the time.
So with your motions, we're just going to make some slight changes. I will take carriage of your motion. We're going to refer number 1 to staff to report back. A slight amendment in number 2, and number 3 I'll take carriage of as is. So I'll type up those amendments. I consider them friendly. I think you'll achieve your goals. I'll have those ready in a couple minutes. Councillor Carroll.
I guess your slight amendments, are they incorporated now? Am I looking at them? Not yet.
No, they're not amended.
Okay, so I'll look forward to hearing what you have to say. I'm glad to hear, Mr. Chair, that number 1 is being referred. I've had a SPIDER case. I don't think it had the name SPIDER yet when I became the proud recipient of one. It was just in the works at that time. And in my case, it was a hoarding case, but I can think of through 12 years a number of times when I wished there was a SPIDER program, and we dealt with it in a much more ham-fisted and clumsy way. My questions about how to work with the community when one of these cases is evolving to the point where it has to be escalated and considered by the SPIDER program are because I think that's one of the biggest problems we have, and giving the councillor the tool and the on-the-ground staff the tools to understand how to communicate to the community in the early stages of some of these cases before it escalates to the point of being referred to SPIDER is really important training that I'm not sure that we've done well enough. Yes, you have to protect the rights and the information of the vulnerable individual, particularly when it's a mental health issue. But be that as it may, what you're left with is a councillor who dwells in the political realm, who daily is confronted with several residents saying, "You're doing nothing, you're doing nothing, you're doing nothing." So I think what we have to do is develop careful language. When the answer operationally is MFIPA, we need a more neighborhood-friendly, user-friendly set of words to use. Yes, we have to protect privacy, but I can't give the answer, sorry, I have to protect privacy, mind your own business, because it's often those residents that brought this to my attention in the first place. And so I have to be able to comfort them that it's an open case, it's being dealt with, we have to stand back and let the city do their work. We've really got to do that. I've had to sit in people's living room and hold their hand and say, we have to let them do their work. And we have to recognize recognize that one day I'll need my privacy protected for whatever reason. And so I have to appreciate someone else's privacy being protected. I had to go through that for months and months and months. Well, it did stretch into years, actually. I'm not sure that all of us do that or have the tools to do that or have the staff that understand that they've got to do that. Sometimes they end up scapegoating staff and saying, yeah, you're right, well, staff won't let me tell you anything. And you don't want that either. So I think that's an important set of tools. We've got to get out there on the ground and to constituency staff, because you know, in some communities, you deal with a number of these in a term of office. In other communities, you may have one per term of office, and as you're cycling staff through your operation, they're not perhaps having the skills at the ready, such that early on, before this even escalates to the point where 4 divisions are all trying to deal with this vulnerable individual, early on, people are knowing what to say to protect that victim's privacy, but to give people the assurances that the city does have tools to deal with vulnerable individuals. So that's an important piece of training. I didn't see outlined here, but I did hear in my questions of staff that it is something they're working on, both the protection piece and the information piece, and that's comforting to hear. Beyond that, I would only say that I have real nervousness about motion number 1, because to my mind, what was most effective about Spider when it was used in my ward was that because it isn't a broad program, these are very special cases. When we added that last component, which was the police, we got a lot of appreciation for this is a special case. We want you to have a special approach to this in Division 33 because it was a very rare and extraordinary thing. And so they really listened to our City of Toronto staff on partnering together and really collaborating to solve it. And mine is, in fact, one of the cases that is somewhat under control. And I'm so grateful for that. Thank you, Mr. Chair.
Thank you, Councillor Carroll. Councillor Fletcher, please.
Thank you. I just want to note that generally in these situations that I have had, and it turns out we've all had quite a few of them, and it's very useful because then we can see how effective the current setup is and make it kind of conclusions if it really is where it should be, if it's working as well as it should. That most of the time when we run into these issues, we have someone who owns a property. For whatever reason, they're really unable to take care of it, but they are not in a state where they have where they're willing to accept help, which is their right. It has a big effect on, particularly in the old City of Toronto, where your house is attached to another, as in Councillor Matlow's situation and the ones I have. These are attached, semi-detached houses. And then it generally, that person is hoarding, other things going on in the property, and they usually do not have a family member who is able to assist them. The family has usually kind of given up on that person. They've walked away. This is a difficult person as far as the family is concerned. Those would be all the characteristics that I would say I've seen over many years. Years ago, the city used to have a property problem table, a problem properties table under licensing. That kind of went out the window. Then when we started realizing there was all of these hoarding issues and impact on neighborhood issues, MLS became very involved at the committee level in starting to drive what are we doing with these situations in communities. That's not only the outside of the house, but also has to do with inside, issues around fire, issues around health, and how can those things be tackled. What happened was, my understanding, my recollection, I believe from last term, That Spider was set up and it was nested in Cluster A, nested as the lead in SDFA. There are partners from the other cluster, that would be Fire and MLS predominantly. But the in charge, if you want to say, would be those in Cluster A. My question really is this as effective as it should be or could be? We have a pilot. Is it operating in the best way possible? Where are the holes? Where are the gaps? Who cares? And you know, where are we able to take action? We don't have to debate the fact that someone says, I don't really need any help, and I tells the social worker that, or tells the public health nurse that, and that's the end of that. It's nobody else's business. The same as if I sent somebody to Councillor Mihevc and he said, I don't need any help. That's not for me to know what your issues or problems might be. It always comes back down to the property as the driver. I'm surprised with Councillor Matlow that when it is having an impact to that degree next door, I think the city has the ability to move in and make changes in the home that is creating the issue in a semi and add it on the property taxes. In my experience, we have added a lot of things on the property taxes in order to make that living space up to standard, because it is substandard. The case that I wish to just briefly tell you about is one where a person did not accept help. Everything was terrible hoarding, had been taken out. In last winter, in the middle of winter, -7 degrees, I found out that there was no heat and no water in this location. I'm sorry. That's not a safe way for somebody to live. We were trying to open warming centers in Metro Hall, and somehow somebody could still be allowed to live in -7 degrees, and they couldn't get the heater on because all of the ducts in the house were filled with hoarded materials. So it wasn't just a matter of replacing the furnace, it was off. At that point, I believe that those who are looking after that person, not the house, there is a requirement to look after that person. They are not safe in that home. That is not a well place. You cannot say in the City of Toronto that it's okay and it's our standard for somebody to be in a -7 degree house. It had been like that for a while. The MLS had ice-picked adult diapers out of the porch because there was no running water for the toilet. I'm sorry. They all knew that. I don't have confidence that the system that we have set up right now to deal with these issues is functioning in the way it should, to be as crisp and effective, and that there is executive leadership at the time when this happens. I had to call the meeting. I had to put my foot down. It moved fairly quickly. The other thing we need to have is a place for that person to go. And how do they sell their home? I know it's very complicated, but there is not enough integration. There's not enough executive leadership, and it's a great pilot, but I think there's a lot more to review.
Great. Thank you, Councillor Fletcher. I will speak now.
May I? I'm just asking the Chair, I don't have any formal privilege, but if the committee would just indulge me for just literally 30 seconds, because Councillor Fletcher, I think, unintentionally said something that I needed to clarify, just in case, you didn't do anything intentionally wrong, but Councillor Fletcher said something that I'm aware that members of my community may be watching today, because we have a very sensitive and difficult issue that we're dealing with literally this morning. In the case that I mentioned earlier, in fact, we've been into the house several times. It has been on the individual's property taxes, and he has been ordered to pay. And we actually came this close to getting the action that I was alluding to. And I can't tell all the details because of the litigious nature of it, but ultimately, this individual has the means to cover all the expenses that he's been asked to cover. So I just wanted to assure those who might be watching that those efforts and those actions have been exhausted to the nth degree. And I just wanted to make that point, and I appreciate your indulgence. Thank you.
Thank you, Councillor
I will just
Mello.
have a point of privilege, because that wasn't my
We-
point, Councillor. My point was there are things that our staff have to be able to do to secure the adjoining homes and move in, and if the work isn't done, do the work. That's my understanding. So if it's moldy, that has to get cleared out from the offending home. That is my understanding, and that's it.
Okay, thank you for that clarification. I've taken carriage of Councillor Wong Tam's motion. We've made 2 minor amendments. I hope you will consider them friendly. On number 1 from your original motion, we were asking staff to report back to this committee on your suggestion to change the threshold of cases. On number 2, we've just deleted enhance intergovernmental information sharing and assistance to vulnerable Torontonians. And on item number 3, it stays as is. So number 2 and 3 will go to council. Number 1 will go to staff. We can vote on them ad seriatim, or if everyone feels comfortable. As a package. All those in favor? Carried. The item as amended. All those in favor? Carried. We will recess till 1:30. At 1:30, I would ask for staff to give us a 10-minute presentation on their response and the implications for Toronto on the federal announcement of the Syrian refugee initiative launched by the federal government. We'll see you at 1:30.
Attention, everybody. We need to clear the room and lock the doors. Security's here. We'll be back at 1:30. Thank you. Attention, please. Would members of the Community Development and Recreation Committee please report to Committee Room 1 for quorum? Thank you. Attention, please. Would members of the Community Development and Recreation Committee please report to Committee Room 1 for quorum? Thank you.
Thank you. Thank you very much for reconvening. Appreciate it. In light of world geopolitical events and Toronto's rich history of welcoming newcomers worldwide, we have asked staff for a briefing on how and what Toronto's role will be in settling Syrian refugees in the city in the coming months. Of course, Syrians are not the only refugees coming here, as well as other newcomers, as we have historically welcomed thousands from around the world. But this is clearly one of the most notable, for the wrong reasons, world conflict zones, creating one of the worst humanitarian crises in the last century. And the federal government has acted. We have asked staff to brief us on what their announcement, what the impacts of their announcement are on the City of Toronto. I would therefore turn the mics over to our staff to give us a briefing. There is a handout before you if you'd like to follow along. Thank you very much.
Thank you, Mr. Chair. Good afternoon, committee members, and thanks for the opportunity to update you on the work of the city. I want to start by providing a couple of contextual comments. The first, in terms of what's directly before us, based on the federal announcement yesterday, is up to 10,000 by the end of this year. So we're not expecting 25,000 by the end of this year, but rather 10,000. That will translate roughly into 2,000 to 2,500 family groupings. So that's what we expect to arrive over the next 5 weeks. And that's nationally, so it's only a fraction of that that will end up settling permanently in Toronto. The other contextual piece I want to provide is that the migration inflows into Toronto have been steadily dropping for the last decade, and we are currently receiving about 50% of the newcomers that we received 10 years ago. So there is some capacity within our systems. I want to start by clarifying exactly what types of refugees we're talking about. They break broadly into 2 groups: government-assisted refugees, who are identified and selected by the federal government and supported by the federal government for the first year in Canada at provincial social assistance rates. And that is a federal responsibility. The second group, and we'll focus a lot on this, is the privately sponsored refugees. Canada's unique in this component to its immigration policy and program. The responsibility here lies with the private sponsors to support the incoming refugees for their first year in Canada. There's a third stream called the blended program, which is a mix of the two. In all instances, once people land, they will be given their permanent residence standing. And once they have the permanent residence standing, they will be entitled to all services and programs that anyone else would be entitled to. Of course, they aren't able to vote, but apart from that, they will have access to all programs and services. The federal plan announced yesterday identified that the target is 25,000 refugees by the end of March 2016. For the remainder of this year, 10,000, which we understand will be primarily privately sponsored refugees. And this is a significant point I'll touch on in a few minutes. There will be an additional 15,000 in January and February. Those will be primarily government-assisted refugees, with additional arrivals throughout the rest of 2016. The federal government has been very clear about the kind of security and health screening it will do out of country before people depart for Canada, and the processing that will occur once people arrive. We understand and anticipate that the most vulnerable families or families with vulnerable family members will be prioritized for transit to Canada. The 2 landing destinations were announced as Toronto and Montreal. Apparently that will be achieved through a mix of military and chartered aircraft, ultimately destined for up to 36 different cities in Canada. The federal government articulated its desire for even distribution across the country. Of course, we will wait to see how that actually happens and what happens at Pearson and Trudeau international airports in terms of further transit to other parts of the country. They've identified an estimated cost of $678 million. That doesn't include the $10.5 million that Ontario has committed or the $600,000 that Council has committed. The other comment that was quite evident in the announcement is, and consistent with Mayor Tory's comments, we know we need to do this fast, but it's most important that we also do it right with respect to the timing. Some key considerations. Toronto has a long history, in fact, our entire history, of welcoming newcomers to the city. This is not a new activity or job on the part of the City of Toronto. We have a strong and well-established settlement sector, a wide range of agencies who have expertise in welcoming newcomers and assisting them in integrating. We have key systems in place. We have been working for the past month to get ready for the announcement. We'll continue to work with our colleagues and focus on the most immediate needs. Next slide. The Refugee Resettlement Program approved by Council in September, October, aims to mobilize existing support. So one of the important approaches here is that we want to get people integrated into housing, into existing systems as quickly as possible to facilitate settlement. The less time people spend in an interim lodging site or some other location, the better. So it's really about working with our existing supports to ensure that they are ready to provide the enhanced support Syrian refugees will need. City has 3 key roles. Coordination. Examples of that are our internal coordinating committee, including the Office of Emergency Management, our external interagency task force, which includes agencies such as the Red Cross, Salvation Army, Local Health Integration Network, and others. Someone else's, okay. So those 2 bodies were formed a month ago. We have been continuing to work with colleagues. Our second role is enhancement. So we will look at where there are gaps or potential gaps, and examples might be support of private sponsors in meeting their commitments as sponsors, and providing additional housing support. The last role is integration. Examples of this would be enhancing our relationship with the settlement sector with more settlement supports in city facilities. We're looking to expand that program, as well as public education activities and such as the anti-rumor work. In terms of impact on Toronto, our immediate priorities are to provide as much support as we can for privately sponsored refugees and the sponsors themselves. It is critical to the success of this endeavor that our private sponsors have the best information and are supported to the extent that we can. We have to do that within a policy framing which suggests that private sponsors are taking responsibility, but we will do everything we can to support them. The immediate issue is housing. So we are working with community colleagues around increasing our housing help services to provide a central place for both landlords and sponsors and refugees looking for housing. And we're hopeful that we'll have those agreements in place within the next few days. We're also working with a number of key agencies around one-on-one supports for sponsors. Again, we're in negotiation with 3 agencies to increase those services and hope to be able to have those agreements completed shortly. We will be holding an information fair for sponsors and refugees on December 8th in the Rotunda. There will be other education and information opportunities. And again, we're doing that in partnership with our community-based partners. And lastly, we should have a web page up by the end of the week or early next week. Next steps. We will be, the interdivisional team will continue to meet, and the interagency task force actually met 2 days ago and will be meeting within the next week. There was a briefing for municipalities and non-government organizations last night with the federal lead. There is a 2-day meeting this weekend organized by the federal leads to coordinate planning. We are working through service agreements with partner agencies, looking to accelerate the kinds of settlement supports provided in city facilities, and we'll be continuing with the education. Mr. Chair, that's my update.
Thank you very much. We'll take questions. Councillor Carroll?
Well, I have a whole bunch of questions I don't need to ask now, because my concern was how the sponsors would fare, and that's very much a focus of your presentation. So I leave you to it. I wonder if I could take you back, though, because I think you can help us with the messaging that we have to do in the community. Your opening statement was that, in fact, the numbers of people that we've had to deal with in the ordinary annual influx of about 260,000 has actually gone down in the City of Toronto over the last few years. That's news to some councillors. They assume that half of everybody who comes to Toronto or comes to Canada stays in Toronto for longer than I believe they are now, and in fact arrives in Toronto. And what are those numbers now?
There has been a significant shift in point of destination, both, well, actually at 3 levels within the GTA. So the settlement numbers outside of the 416 have been significantly increasing while our numbers have been decreasing. Numbers in the rest of Ontario have been increasing, and perhaps most notable, numbers in the rest of the country have been increasing. So it was about a 50% drop between early 2000s and 2013. And we're at 50% of what we were at our height.
Right.
So I did want to make that point and emphasize the point that this city has a history of integrating far larger numbers of individuals. Now, that's not to downplay the particular vulnerabilities that this population will have, and the special attention that will need to be paid to those vulnerabilities.
So I'm wondering if that can be incorporated somehow into some of the literature. I think you just confirmed the theory that I've had, because we see the numbers, you know, in deep dive reports, but I think a certain understanding of how many people arrive directly in Toronto and stay in Toronto for longer periods was sort of cemented at the point of amalgamation, because our advocacy on behalf of all the legacy cities and the funding that the new city would need were around what was happening in the 90s, and that has changed. Can that somehow be conveyed? The mayor has been really good at communicating on this issue, but that's a component that I don't know if he has language on that. Will the team be able to provide him with that?
Absolutely. We are finalizing a briefing note for all members of council, and we'll look to integrate some of that data into the briefing note.
Super. Those are my questions. Thank you, Mr. Chair.
Thank you, Councillor Carroll. Councillor Mihevc?
Yes, thank you very, very much. I'm wondering about the $600,000 and how that is being used, and I have a little bit of a not-so-hidden agenda there.
So at this point, we are in negotiation with 5 different community partners around specific elements. So the funding will be used primarily for ensuring that we have appropriate housing support in place, ensuring that our partners who are dealing with sponsors have adequate, and the demand has been huge, which is a very nice problem to have because the community is very interested, but we need to beef up our ability to manage those inquiries and to work on the information campaign.
Right. So if I'm getting this, to put it in very brief, we're focusing as a city, this is our piece, so not that there's a whole bunch of agencies out there, we're not reinventing any of that we're though functioning as a coordinating body.
Correct.
To those agencies. So if, you know, as the refugees come and Costi says, you know, we're being flooded with English as a second language and St. Stephen's can't do it and Learning Enrichment Foundation can't do it, there's going to be a meeting where those kinds of issues are addressed. Or if there's a mental health issue, series of mental health issues for people who are struggling, frankly, going to be coming here having struggled with trauma, we're going to be able to get the agencies in one room and say, okay, this is the need right now, and then we go to the province and the feds and say, they're here, this is what we're identifying, we need to find some funds for those particular task areas.
That's correct. I am sensitive in this that the city is not picking up federal or provincial responsibility.
Right.
So it's not a matter of in effect, subsidizing something that the federal or provincial governments are committed to. Rather, it's identifying those key elements that no one is responsible for.
And
enhancing
Okazi does some of that, and they do it very well. And we're going to be in another forum for the bodies to get together. Okay, I get that one. The second one,
And this is
though-
all done in collaboration with Okazi, so
yes.
I'm working with Debbie
Yep,
on
yep,
every
I'm sure you are.
decision.
I'm sure you, great, okay. I think that's an important point to really get out there so that people don't think that, I want to sponsor refugees, call 311. No, don't call 311. Call Costi, call
Lifeline Syria,
call those other agencies.
Catholic Cross Cultural, yes.
Catholic Cross Cultural, there's all kinds of agencies out there that do great work.
That's a very important point, Councillor. We're not trying to recreate systems that exist in the community in City Hall.
Right,
We will work with those community resources to make sure they're able to
The
respond.
second one is the anti-rumor stuff, like with, when you see some of the stuff happening in the United States, it kind of sends chills down my spine around xenophobia, Islamophobia, and so on. Can you speak, I'm going to give you the opportunity to speak, and I hope that you're going to be very strong in that campaign. But could you tell us what exactly you're going to be doing there?
Well, I think we will be following the mayor's lead, where the mayor was very clear that Toronto will not tolerate discrimination or racism or hatred in our response. We're all very disturbed by the events in Flemington and other things that have occurred. So the campaign will really be targeted at that. Again, we will actually be working very much with Okazi on that piece of work. We have a bit of work to do in terms of getting the framing right, but I'm hoping within the month we'll be able to come forward.
Great, okay, we look forward to that. That's an important piece that shouldn't be forgotten.
Agreed.
Thank you. Thank you, Mr. Chair.
Thank you, Councillor Mahavik. Councillor Ballo?
I want to touch base on a little bit of the role of coordinating the resettlement work, because once the people get here, it's crucial that we resettle people appropriately. And I'm a little bit concerned on this 12-month assistance that is going to be provided. It seems like a long time, but it's really, really a short time. So are we also asking our partners in the agencies to maintain some metrics, like after the 12 months if we find that we have 50% still of the people unemployed, how do we get actions to help that, to make sure that, after 12 months, everybody goes, oh, 12 months are up, and we leave these people out there? Like, how are we making sure that we're actually resettling and following and taking the metrics to make sure that we have these people integrated in our communities properly?
That is part of the role of both the interdivisional team and the interagency task force that has been established, and certainly through the federal government who funds the settlement system and requires that reporting, those metrics, we will be tracking. You're absolutely right. It is 12 months is actually quite a short time, and it is imperative that we do the absolute best job we can do in that 12-month period to see as many individuals successfully on their own, in their own housing, with their own employment, to be successful overall.
But if we don't, we are paying close attention to make sure that we have the mechanisms to continue to make sure that if it is on the 13th or 14th or 15th month, that we continue to fight for them.
Absolutely, and those individuals will continue to be eligible for settlement support beyond the 12 months from federally funded programs. But we will be paying close attention to this because there are implications for the city if those individuals are not fully engaged in the economic life of the city.
Exactly. On the housing support, so you said that part of the $600,000 was actually to help with the housing support. Can you be a little bit more specific on how our role is going to be?
So the city currently funds a range of housing help centers across the city. And in fact, we fund a number of them that are located in agencies that are also settlement agencies. So we're talking with a couple of those agencies about ramping up the housing support services in two ways. One, to create the capacity to maintain a registry of interested landlords, and two, to be able to provide support to additional sponsors and refugees.
So let's be clear that these refugees coming to Toronto will in no way impact our waiting list. The people will be supported through the refugee program, through the programs that they have, and the only assistance that the city, through the funds that we have, is actually helping them find homes, most likely in private landlords that they will pay through the subsidies that they receive through the resettlement program. Nobody will come down the housing waiting list. Nobody will be longer on a housing waiting list because we are open our doors to refugees. Is that correct?
That's correct.
Thank you.
I had some questions, but I think most of them have been asked. Anyone else before a second round? That's pretty nervy. Okay, sure, go ahead.
Sorry, we had talked with staff a little bit about, really providing a welcoming environment by providing, frankly, a Welcome to Toronto package. Did that gain any steam, and is that kind of...
We're working on putting that package together.
Great, wonderful, thank you.
So, I mean, Toronto obviously has despite maybe a decline in refugees coming to Toronto because of the exponential growth of suburbs, we do have this rich history of welcoming refugees and newcomers of all different categories. I have a number of 40,000 newcomers each year to Toronto. Is that in the ballpark? Are we? Yeah. So we...
Permanent residents, yes.
Okay. So they are new each year, coming to our city under various, there's multiple federal programs and classifications of persons coming in, including...
Correct.
Okay. And they are eligible, depending, it's a bit of a checkerboard, but depending on how they're coming in, they're eligible for various programs or federal programs, municipal programs, and of course, access to city services.
If they have permanent resident status, yes.
Okay. So, as far as pieces in place, you've referenced that. Is this an unusual spike, or we're ready, we're prepared, and there's not a significant ripple effect through either our social services area or our agencies or our partners, where we can handle they estimate 2,500 over several months. It's actually, if it's based on the period that they're looking at, the timeline, it's actually not that much per month.
In terms of the overall numbers, it is certainly well within the numbers of people that Toronto has received historically. It is not particularly striking in that regard. What is striking is the context from which people are coming from, and the needs that they may have as a result of that, and the fact that there will be such a steady flow over a period of time.
So by achieving permanent residency status, you've mentioned that they're eligible as full Canadians with every right and privilege with the exception of voting. Is that would be it?
Generally speaking, yes.
And that is after the first year or immediately?
Immediately.
Immediately?
Once they have their landed permanent status.
Mm-hmm. And anecdotally speaking, the private sponsorship agreements, do they hold pretty good or?
It's been a very successful program. Yeah. Quite frankly, to have survived as long as it has to have been a successful program. And it's actually, editorially, quite a wonderful program in that it engages Canadians in the settlement process or people who are already here in the settlement process in an active way.
Now, school-age children become the greatest challenge, or one of the greatest challenges, other than cultural and language barriers. TDSB, ready?
Yes, they
able,
are on the
and engaged
interagency
in this
task force.
discussion, yeah?
Again, we met a couple of days ago. All of their systems are focused on this. I have to say I'm very impressed with the way Toronto District School Board is preparing and all of the kinds of services and considerations they're putting into place.
I should also, I guess, mention the Catholic School Board, I believe, will, based on what I'm reading here, will also get some students as well. Okay, that's all the questions I had. Thank you very much for the presentation. We can go to a short speakers list if anyone would like to speak. Councillor Mihevc.
Thank you very much. I do have a motion, and, you know, I debated whether I should put it forward, but it really just endorses the actions taken by staff. I think we should, as council, go on record as supporting what staff is doing. So this really is a way of us as a city hall making another statement saying we're behind staff in doing this. We're part of this. We like it. We think this is the right thing for us to do as a city. So it's an affirmation kind of a motion. And you know, let me say this. You know, you see what's happening in the United States. I think the last count was something like 30 governors have said that we don't want refugees in our state, and another 10 have not said anything. There's a very small number of people, small number of governors that have actually said we welcome them. And then you see what's happening with some candidates, political candidates as well. And then you got to wonder, like, why were we different in Canada? Why, from the Prime Minister to virtually every premier, to our city, to mayors, our mayor, why did we take a different tack? And it's not just the weather. I think it's worthy of reflection. And to me, I think, speaking to the Toronto case, I think a lot of it is, yes, because we have had a long history of welcoming new immigrants and refugees, but I think, too, it is a testament to the work of frankly, staff here at the city, who in even the former municipalities had 6 working groups on access, equity, human rights, that it always included an immigrant piece to it. To the, I forget how many, I think there's 150 agencies that work with OCASI around welcoming immigrants and refugees, some ethnically based, some regionally based, and so on. I think it's a statement about all the advocacy, like the folks that no one is illegal, that we're going to hear about in short order, that they do to make sure that there's a climate of opinion in this city and in this province and in this country that welcomes immigrants and refugees. So that when something happens, like happened last week in Brampton and where else did it happen? Flemington Park, that very quickly people's spines get stiffened. They say, no, this is not the Toronto that we believe in, that we love and support. You know, it's been interesting. I'm our ward, Ward 21, upon the urging of some residents, we've organized to basically do fundraising for 2 refugee families. And so we organized a dinner at the Witchwood Barns, a supper with Syria dinner is what we're calling it. And it was very interesting. After what happened in Paris and the rise of call it the xenophobia or fear or whatever was motivating people, in our case in Toronto, you know what happened? Ticket sales went up. They skyrocketed. And I think what happened is some people got afraid. Okay, fair enough. We have to understand that and address that. And some people said, no way. In my city, I'm going to be part of this. And what I'm seeing is all kinds of people, and the people who are buying tickets, they're part of other groups that are already sponsoring refugees. And it's lawyers groups, professional groups, neighborhood groups, faith community groups, bowling clubs, book reading clubs. All kinds of folks are getting behind that. And, you know, many times, sometimes you feel depressed about the city. Right now, I feel with what we're doing as a city at a very grassroots level, the level of awakening is really something that's heartwarming. And that motion really is an intent to say kudos to staff. They're doing great work on this. And kudos to the community agencies and people who are opening their hearts and their homes and their wallets to help make this happen.
Okay, thank you, Councillor Mihevc. Any other speakers? We could vary the procedure and include you if you like. Councillor Carroll.
Just briefly, the only thing I didn't hear, and I think it's going to be fairly complex to be able to do this, but I think that whatever we do on the front of xenophobia is going to have to somehow assist the two major school boards as well. There is great difficulty there reaching right down into grade school levels. It has the ability to do the most harm there. Because children there see it very simply. You're saying terrible things about immigrants. I'm an immigrant, or my mom or my dad is an immigrant, and it is going to turn into a powder keg. And as they are right now going through a leadership search and have certain things, any way in which our agencies can somehow fold them in and partner with them, I think is going to help. I don't think there's a need to add it to the motion so much as just for councillors to be aware that in their work with the agencies, if they're calling meetings, you maybe want to fold in school leaders wherever you can into those types of gatherings where you're going to put your heads together and address this problem, because I think they're going to need our support. They're in flux at the moment, but we're already hearing it. Children are already coming home, and then they're phoning us to say that there was some very upsetting talk in the schoolyard, which is sad, but I think it's easily addressable if, like everything else Mr. Brillinger just reported on, we all get together in the same boat and row. And once again, as I prefaced my question, I was at the Mayor's Town Hall in North York that was aired on Rogers, and I couldn't be more proud, because it's clear. You just have to turn on an AM talk radio station to know that on a certain level he's taking a bit of a political risk, but he's saying damn the risk and messaging on our behalf in a tremendous way right now.
Thank you. Councillor Bello.
I want to echo the comments that were made here and bring also a new point that I think wasn't touched in here. I think that we should be proud of Torontonians and the feeling that is also in the air. Even though that we did have some incidents in our city, I think that are much more the number of people that are doing different things like food drives and clothes drives and sponsoring people, and then the ones that are actually practicing the acts that we say have nothing to do with Toronto. So I think we should still condemn those acts, but we should also be grateful to have a city that has so many people that are opening their homes and opening their hearts to the refugees. But I want to bring something which is the settlement services. You know, we've seen our settlement services in this city having severe cuts in the last few years. And what happened was, you know, we have received a reduction of 50% in the immigrants, but settlement does not only happen in the first 12 months or 24 months. Settlement is something that takes time, and you need to follow up. And if we are a richer city because we have so much diversity, and we learn how to live with that diversity, and we learn how to cohabit with each other's values and in a healthy way, it's those challenges that faces that makes us stronger, but we still have to deal with them. And we need to make sure that we don't, this is not a project for making us feel good, that we are so good that we're receiving all these refugees, that we are there for the month 13, for the month 14, for the month 15, when those challenges come and when the resettlement continues to happen. So I think it is important to make people understand that we've done it in the past, and it is really important that we continue to collect these numbers so that we continue to serve these communities in the future when the challenges come, when the other levels of government say, oh, we've done our job, time to step back, and now everything is fine. And if it's not fine, that we have the information required to make sure, no, we still need to continue supporting this community or that community because we still have those issues. So I think that is really important, and that will make all the difference in the future of the city and the communities that we have.
Great, thanks very much. Any other speakers before I share a couple of comments? No? I would, I'd simply like to echo many of the things that have been said, and thank staff for working on the file so diligently. Our city newcomer office is small but very robust and very effective. Do they need more resources? Yes, but are they doing a great job with what they have? The answer also is yes. And one of the reasons that Canada has been fairly successful in welcoming newcomers from all categories across the country is our emphasis on a fracture from world conflict zones and not bringing in the conflicts of other worlds into Canada, to starting fresh with respect, with tolerance, with the primacy of rule of law, and making sure that everybody has a new beginning here. The sub-theme of this committee is social cohesion. And social cohesion is driven by the respect that leads to civility. And that kind of civility makes us understand what it is to be a Canadian, what it is to be a Torontonian. And these values are instilled not just in the screening process, where we are entrusting our federal counterparts to make sure that the people that we are welcoming into these countries want to adhere to the respect and tolerance, to raise families, to grow a business, and to commit ourselves to the diversity that makes us so strong. And with that, we must also play a role. Refugees must not be brought here to fail. They must be brought here to succeed. And the role of government has that responsibility to make sure that newcomers succeed. But also, as seen in the statistics here, the private sector and private donors and private agencies also have an enormous responsibility to make sure that the work they do with newcomers is successful and has positive outcomes. But when many people come from world conflict zones, they want to live in quiet communities and quietly live their lives and raise their children and watch future generations flourish. And the early years will not be easy. And many of the people who I talked to, whether they're grandparents or great-grandparents, when they arrived on these shores, the first 20 years were very difficult as they got a foothold in the workforce, learned the language, learned the culture, and raised their kids and put them in school. So we can't turn these things around overnight, but what we can do is bring newcomers in for a soft landing, a fresh start, and provide the encouragement and values and resources to make it successful. So with that, we do have the one motion before us. We can put it on the screen. All those in favor? That is carried. And because it was a presentation, we don't really have an item as amended, other than... You could forward it to council for information as well. Yeah. Okay, why don't we have another motion to forward this along to council? All those in favor? And receive for information. No, we're sending it to council.
That city council received the presentation, and this would come with it.
City council receive presentation. All those in favor? It's carried. Okay, we're on item 8.4, access to city service for undocumented Torontonians, progress of Access TO initiative. We have 5 deputants. I hope they're still with us. McDonald Scott of the regulated Canadian immigration consultants firm Carranza. Who's coming? Is McDonald Scott here?
I think that's Carl Gardner.
Carl Gardner? Oh, that's you? Oh, we'd love to hear from you. Josh, can you just take the chair for a sec?
Does that work?
Welcome, go ahead.
Hello, councillors. Thank you for having me here today. My name is Carl Gardner, and I'm a member of Known as Illegal Toronto. We're an organization that works primarily with undocumented Torontonians in the city. And I'm also a co-author of the report titled Often Asking, Always Telling, a report that you guys all received on Monday, and then we officially released today. I wrote this report with University of Ottawa professor David Moufette, but he unfortunately couldn't be here today. So I'm just going to give you guys a little bit of context about what we found in this report and why it applies to the CDRC. The data we found were both alarming, but also simply confirmed what community members have been telling us all along. That the Toronto Police are consistently racially profiling Torontonians, performing routine and arbitrary status checks on these people, and when they're finding out that somebody's undocumented, they're handing them over to the CBSA, who throws them in maximum security prisons for indefinite amounts of time. The only way in which we can stop this is for the Toronto Police to adopt a full don't ask, don't tell policy. And because of the continued resistance of the police on this, we're asking that the city step in and fulfill its promise to its undocumented residents to provide a safe environment for them to live. The Toronto Police are the most active participants in seeking out and reporting undocumented residents to the CBSA in the country, accounting for 31% of all calls made nationwide. This signals an active willingness on the part of Toronto Police to do the work of federal immigration enforcement at the municipal level by targeting individuals based on the color of their skin or their accent. In fact, immigration status checks may be the most overt and underreported form of racial profiling in our city today. We found, through access to information requests and government data, that the Toronto Police have reported 100 individuals every week to the CBSA in the 9-month period that we did our study. That's about 14 people per day. More concerning than just the pure numbers, however, is the official reason for these reports. 83% of individuals reported were reported on the basis of a status check, which is justified by a vague officer suspicion that an individual may not have full immigration status and may be of interest to the CBSA. These definitions for the reasons of the calls were also supplied to us by the CBSA and through our access to information requests. This vague criterion of officer suspicious is fertile ground for racial profiling, a problem that we know is a massive one right now in Toronto Police, given recent debates in carding. As well, it's useful to note that only 7% of individuals that were reported by the Toronto Police actually had an immigration warrant out in their name. That means that the Toronto Police are actively and willingly seeking out these individuals and handing them over to the CBSA. So what this tells us is that the Toronto Police are not accessible, currently they are not an accessible service to all Torontonians, which is mandated to them by the Toronto Sanctuary City policy. We're here today because it is this committee that is directly responsible for the implementation of Sanctuary City policies, and especially now that it's been in effect for 2 years, we need to start looking at bumps in the road in implementation. Given the continued resistance of the Toronto Police to implement a full don't ask, don't tell policy, with regards to immigration status, that's why we're here asking the city today to do its part and step up and to ensure the policy is adopted. There is no legal basis to prevent a don't ask, don't tell policy from being adopted by the Toronto Police. All this requires is a show of political will. Now, the Toronto Police have publicly stated otherwise. They have said that a full don't ask, don't tell policy is indeed impossible. I would like to say that this is simply false. The police have claimed that they have a don't ask policy in effect right now that protects victims and witnesses of crime from being status checked. Not only do the testimonies in our reports represent many stories of people who were victims or witnesses of crime, who were asked their immigration status and subsequently handed over to the CBSA. But there's a bit of word slippage here right now that the Toronto Police are using. While after adopting their policy in 2006, they might not ask individuals directly for their immigration status, what they're doing is instead just asking the CBSA. Once they apprehend an individual who they think might be of interest to the CBSA, they will call the CBSA in a status check and check if they have status. This is obviously informed by the way somebody looks or their accent. We also want to make sure that the Don't Ask policy includes beyond victims, witnesses of crime. It actually includes people who encounter the police through racial profiling, through carding, or any other arbitrary encounter. These folks are not protected under victims and witnesses of crime. As for the Don't Tell policy, the Toronto Police state that they have a legal obligation under the Ontario Police Services Act to report individuals whom they discover are undocumented. This is simply false. There is no Ontario or municipal law that states that officers are required to hand individuals over who are undocumented to the CBSA. There's nowhere in their mandate are they compelled to do so. The Ontario Police Services Act, which is legislated provincially, states, and I quote, they may disclose personal information to other authorities. May, not must. Okay, so what this is telling us is that it is as much within the mandate of the Toronto Police not to report individuals as it is to report them. This discretion, however, is not being exercised at the officer level. So I'm here today to ask the CERC.
Could you wrap up? We're at 6 minutes.
Oh yeah, sorry.
Thanks.
I'll just wrap up by saying that we don't believe that the police are going to stop racially profiling, but the motions that we hope to put forward today and that we hope to get the support from city councillors will diminish the worst consequences of this police misconduct. Thank you.
Thank you. Any questions for the deputant? No? No? Okay. Is that a no? I mean, you don't have to make up stuff. If you have questions, well. Okay. Councillor Mihevc.
So I'm trying to understand. I think the current policy says that the police will not ask anyone who is either a victim or is it a witness to a crime that they are not to ask their immigration status. But you're saying that what is happening on the ground is that, if you could just expand on this, they're not asking the individual, so they stop me and they ask me for whatever, any documentation whatsoever, and they would go to their checks and find that they don't have, that they're undocumented, and then then the other half would kick in, namely, they feel now obliged to report under their policies. Is that the way it kind of is happening?
Yeah, so in 2006, they passed a Don't Ask policy. And since then, what we've seen is a shift from asking the individuals themselves, who are victims of witnesses of crime or otherwise, to simply just asking the CBSA. And asking the CBSA to check if they have full status. An individual that was brave enough to share his experience in our report was a witness of a violent crime, came forward to help the police in their investigation, and as he was helping them in their investigation, they were running his name through the CBSA. They found out that he was undocumented, they handed him over to the CBSA and detained him for almost 3 months, taking him away from his wife and newborn son. This is a clear contravention of an access without fear policy mandated by the city to the Toronto Police under the sanctuary city policies.
And the other piece, don't tell. We have documents from the police that say that they are mandated to tell. As your position is that they are not mandated to tell. They have it's a may. The word is may, not must. And have you checked that? Like, you know, we have gazillions of lawyers around here. Have you run that through a formal legal opinion?
I can absolutely assure you that we have. I mean, this is not a new fight. An Immigration Legal Committee submitted a 40, 50-page report on Don't Ask, Don't Tell and its legality in 2008, which was presented to City Council as well. I also just want to state that the argument can be made that collaboration is indeed encouraged in the instance of an immigration warrant being out for this person. But like I said, our government data shows that only 7% of people who were reported in the last year of our study actually had immigration warrants out for them. So this is a very, very small minority of cases that this is happening in.
Okay, thank you very much.
Thanks.
Thank you, Councillor Mahavik. Councillor Burnside.
Yeah, thank you. So you use a number here, 83% of the TPS, 83% the TPS makes to the CBSA, right? So what percentage of these calls are for people that are actually arrested?
Pardon me?
So when the police are making these calls about individuals, 83% of the, for our status checks, right?
Mm-hmm.
So we have victims, we have witnesses, and I get those two categories, but what about the category of people that are actually arrested? Where do they fit into this 83% of these status checks?
The classification of calls given to us by the CBSA doesn't say.
So,
however, what we need to be focusing on here is that like 83% of these people were status checked in the first place, which is signaling like an officer's suspicion of certain kinds of people.
Well, so let me ask you this. If someone's arrested for whatever the offense, you're suggesting there should not be a status check?
What I'm suggesting is that the vast majority of these people are probably not arrested.
No, that's not the question. The question is, are you suggesting if someone's arrested, they should or should not be status checked?
The Toronto Police should not be enforcing federal immigration law. If they're
they should not be status checked.
If they're arresting somebody for a transgression that may or may not have occurred, they should be focusing on that and not the person's status.
Okay, so just to be clear, all I'm asking for is a yes or no. Should they be status checked if they've been arrested?
Yeah, I think I've given you a couple answers, but yes, they should not be status checked.
They should not be status checked.
For scenarios that are wholly unrelated to immigration.
Thank you.
Councillor Ballo.
Do you think it'd be helpful if we have those numbers? So there's a very high percentage of the calls that are made by TPS, but do you think it would be helpful for us to differentiate the ones that are done by somebody that was charged or arrested, and then that we clearly can get to the bottom of it and saying there's people that had no reason to be being checked, and they are being checked. They had never been arrested. They had never been, they're basically just being now asked for that. Do you think it'd be helpful if we get those numbers?
I mean, we've been asking the Toronto Police for numbers on this repeatedly over the last 6 months, and they've claimed that they don't have it. So we went out and got it ourselves. Obviously, more information and more stats on this would be helpful. There's no question about that. However, the CBSA and the Toronto Police don't keep these detailed records of stats, so it's going to be hard to get them. But I think, and what this report is really trying to bring forward, though, however, is arrested or not, the police are routinely status checking people based purely on the arbitrary criteria of officer suspicion, which we know from current debates on carding is fertile grounds for racial profiling.
And what the message as well is that we do have a federal department that enforces immigration law, and that we have plenty of work that the TPS needs to focus on, that, you know, it shouldn't be a priority for TPS to be enforcing immigration laws. That doesn't mean that when you have a problem in front of us, that somebody committed another crime, that if at that time, you know, there is an immigration status requirement, or if there is in the future some collaboration that needs to be had, but having it voluntarily it's not in keeping with the direction that the city has set as a sanctuary city.
Well, we are of the opinion that there should be no collaboration between Toronto Police and the CBSA because we believe that is in direct contravention of the sanctuary city policies, which establishes that all municipally funded services are accessible to all Torontonians regardless of immigration status. The only way to ensure this is not simply a partial don't ask policy that's been passed right now, but a full and comprehensive don't ask, don't tell policy. Thanks.
Any other questions? No? Thank you very much.
Thank you for having me.
Now, I'm not sure whether the following people are in the room. Haya Rizzi, Jean McDonald, Ellie Adekour. No? Okay. So we're done with deputants. Questions to staff? Speakers? Councillor Mahavik.
And it is an amalgam of the some notes that I got from staff. The first four are based on that. And the fifth one is based on some conversations with the No One Is Illegal community. So I'll go through them. One is that the City Council requests the Police Services Board to request the police chief to report, to provide data on the number of times a person is investigated on an offense related to Immigration and Refugee Protection Act. That's just simple information gathering. The second one is that City Council requests the Police Services Board to request the Chief of Police to develop a protocol between police services and Canadian Border Security Agency to prevent information going forward from one authority to another authority. Third, that City Council requests the Police Services Board to request the Chief of Police to review the procedure where a distinction is made between immigration warrants and other arrest warrants in order to ensure the access without fear policy is implemented appropriately. Fourth, that council direct that the city's access TO material be revised to include the addition of Emergency Services 911 and delete the deletion of Toronto Police Services. And then the fifth one from the community sector is to expand Don't Ask beyond victims and witnesses, which is the current policy, by the way, to include all encounters with police unless there is a warrant. That covers, I think, Councillor Burnside's question, unless there is a warrant for the person's arrest. And fourthly, a don't tell component, and I suspect that given that the police chief has issued his report, there is legal opinion that says that that there is discretion here, that the police board would be wise to get a legal opinion on whether it is a must or a may that they report immigration status once they know it to the Canadian Border Services Agency. So those are my motions.
I'm going to have, having them printed off, I'd like every committee member to get a copy of them and to read them carefully. These are very substantive changes and already are raising some concerns. So let's take a close look on how this is written. Feel free to continue. You still have the floor.
Well, I don't know. Let me start with the say number 4. Number 4 speaks to basically the issue of we have a sheet of we have a card that is in all our social service agencies, and that card says that you may access and you will not be asked questions to go to our library, to participate in the REC program, to enter the TTC, et cetera, et cetera. And one of the services that is listed there is the Toronto Police Services. Toronto Police Services, if even a percentage of what is being put forward today is accurate, we are putting people in harm's way. So the minimum that we need to do is to make sure that if there is an agency that is not able or willing, judgment suspended for the time being, say that they will not, that they may ask, they might ask, then I don't think it's appropriate that they be listed on the accessible services to all Torontonians. The issue, as I said when I was reading it, 5B, maybe I'll speak to that a little bit, the don't tell component. There's a debate in the legal community, or maybe it's not a debate in the legal community, but certainly between the legal community and the police over whether don't tell is driven by law or is it driven by policy. We've been told by the police that it's driven by law, and the legal community, or at least some in the legal community, are saying that it's driven by policy. So, and that policy can change, and that urges that it be changed, and I would think that the board, the Police Services Board, would do due diligence on this. So maybe I'll end my comments there. Like, I could go on for a long time on this.
Thank you, Councillor Mahavik. Any other speakers on? Oh, we're on speakers. Oh, you can do questions to the mover? Sure. Councillor Burnside?
So I'll probably jump around here, but 5A, the expand, don't ask part, unless there's a warrant. So what about if someone's arrested? Is it okay to ask if you've been arrested, if someone's been arrested?
You might be able to give me some advice there.
So a warrant, so there could be a warrant for your arrest. You may have committed a crime, and so the police didn't actually apprehend you, so they put out a warrant for your arrest. Okay, that's that.
Okay.
But if you commit a crime and the police catch you either committing it or shortly thereafter, you're arrested.
Right.
So the warrant is where.
You know, my honest opinion would be similar to the deputants, that if you got arrested for shoplifting or for whatever, assault, that should be the focus. It shouldn't be whether.
How about aggravated assault?
Aggravated assault, whatever it is, that should be the focus, is the crime that has been committed. That's my honest view.
So it doesn't matter what the crime is. Like, there's no differentiation between taking a pack of gum and killing somebody.
I think your point is that once arrested, that the police should then.
I didn't say should, but I think what you're trying to say is don't ask. You're sort of handcuffing the police at that point. You're not leaving it up to their discretion. So what I'm saying is it reasonable that if the police arrest someone to ask that question? So let me just give you a little bit of background. When police arrest someone, they want to try to identify them. And so usually you just ask for identification. Doesn't matter who you are. And if they can't identify you through actual, driver's license or whatever, they go through various steps. So,
Councillor Burnside,
He's asking a question.
I know, but
yeah, no, but I'm trying to get
a little concerned about where the conversation is going.
Well, the conversation is going is it reasonable to ask? Like, you're saying the police can't even ask.
I think if it would be helpful to you to support it, to add, unless there is a warrant for the person's arrest or unless arrest takes place, would that be helpful to you? Is that what you're saying?
That's one part of it. Yeah, thanks. Well, then you get to point B, the don't tell component. There's no use asking if you're not allowed to tell, right? So if you arrest someone for whatever, let's say it's something more serious, forget the pack of gum, but you arrest them for something more serious, and they say, oh yeah, here's my name, and I'm here illegally, whatever the case is. But if you're not allowed, the police can't then use that information. The fact that they were able to ask it is irrelevant and useless.
Yes, I think the second component is, for example, for a street check, right? Or if
No, I get
if it's
that. I'm not-
non-criminal, if it's
No,
not
I'm
criminal.
only talking criminal matters. That's the thing that, victims' witnesses, Counselor, I absolutely get. No issue. I'm really talking about when people are arrested
Oh, I see. Unless,
for a criminal offense,
so adding the.
not a
words,
bylaw offense, a criminal.
Unless related to a criminal offense. Would that be helpful to you?
That'd be helpful to me, yeah.
Okay, unless related to a criminal offense. Okay, so, I take those questions as helpful in terms of, I'll work with the staff, but
Okay.
then I want your support, buddy.
You'll always be my buddy, Counselor, even if we
I
don't.
want
ag-
your support.
You know I love you. But-
Okay.
So no, don't I have another minute? Or am I?
Sure, take another minute.
I haven't asked a question all day. I've sat here patiently.
No, you're owed.
Chair.
You're owed a lot, actually, and please
Thank you.
proceed.
Thank you. So I guess one of my concerns is sort of the tone that this would take in terms of the emergency services replacing the Toronto Police Services. One of the issues that's being dealt with, actually, I represent Flemington Park, where there was that horrible, horrible case of a Muslim woman being beaten simply for walking down the street and who she is. One of the issues, as I understand it, or certainly was, is finding witnesses. And my concern is that this reinforces fear of the police and breaks down that relationship. So do you have any concerns about that?
Well, of course, I have concerns about that, but I don't think that's related to this, frankly. I think that this is related to, there has to be confidence from the public and from agencies serving the public, and especially serving undocumented Torontonians. There has to be confidence that when you tell someone who is here without documents, oh yeah, you can go to the police, you don't have to worry about it, and then you go to the police, and then you find you're on the plane the next day, that's kind of not, it's not an accurate I'm concerned here about an accurate representation. If we provide that service, if we provide a policing service to someone who's, say, a witness to a crime, and that service is that we're not going to ask your identity, then we have to back it up. We have to mean it.
Absolutely, but that's a different case than not mentioning the police on your brochure. Absolutely, that needs to be addressed. 100% no argument. We can agree on that. But what you're doing here is you're deleting the name Toronto Police Services, and I think that's really sending out a message is that the police can't be trusted. And I think that goes far beyond.
Yeah.
Uh,
I mean, we're not a debating society. They weren't. The questions were clarification of the motion.
Don't worry about it. I'm good. I don't have a question. It's fine.
So certainly, Councilor Burnside, you can make those comments when we get to speakers.
Are you okay with that?
Anyone else to speak? Yeah, Councilor Bello.
I'm going to have an amendment to Councillor Mahavic's motion on the number 2, and it's just that we can get better information, and then at the board, hopefully they'll come back and get to this. But the point is, and I spoke to Councillor Carroll, and she'll make sure that this information is well used. What we want is to get information to the board so that then they have the information to assess and develop that protocol that eventually we want them to. But we want to get that information. So I am changing number 2. Just a few words, and I know that everybody is going around on number 4. This is not confidence vote or non-confidence vote on the police. This is the City of Toronto endorsed a policy that is called a sanctuary city. We promote it as a sanctuary city and the services that can be used. And to clarify that, because we deliver a lot of services that are provincial services and so on, we have to have a list of services that we provide where we should not ask for status. You're going to the library, you're not going to be asked for status. You're going to the swimming pool, you're not going to be asked for status. People are going to be okay. And it's the same thing with the police. Now, we cannot guarantee an individual in this city that if they go to the police, that they're not going to be asked their status. And I think we have to be honest, and that's it. Police made a decision that in order to do their work, And we're not here to judge that. That's for the Police Services Board and everything else to do that work. But they've made a decision that they need to make those calls. Some of us have certain concerns about that. The reports came out. But what is at the bottom of it is that what we have in front of us is the police decided that they need to make those calls. We have to be upfront to the people, and with the policy that we're saying that they've decided that, they're going on that route, and therefore we cannot guarantee you 100% that if you contacted the police that you're not going to be checked your status. And that's it. And I think that as a government, you have to be honest. So this is not saying we don't trust the police or trust the police. It's happening. It's what's happening right now, and we have to be upfront. Because if somebody gets deported tomorrow, if you know, we need to take ownership and responsibility over our actions. That's what we're asking us to do here. It's responsibility over an action that one of our agencies is doing. We define the sanctuary city, and they're acting that way. And so that's why I think we need to be forthcoming and replacing with the emergency. Just saying emergency services. Again, we've discussed this policy many, many times about the sanctuary city, and we have to understand that we have an immigration system that is flawed, that is not responding to the economic needs of our country, that we have people that come in here for economic reasons. We have, we're not a federal government, and that is not for us to decide immigration policy in here. And the same way that it is not for us to decide immigration policy in here, once these people are here, and some of them, a lot of them are our neighbors, and they're all around our city, believe me, that we need to make sure that we have good communities. These people are here. Now, that does not mean that we're going to protect criminals or we're going to, no, but it means that if anybody's walking down the street, it's not our job as a city or our police officers to be questioning if they have an immigration status or not, or if they're witnessing a crime, or if they're the victims of domestic violence, that they feel comfortable enough that they can approach the police as a service and feel confident that they are protected by our police force. That's all we're doing here. We have an immigration policy that is done by the federal government. We have the Canadian Border Services that is run by the federal government. They need to enforce immigration warrants and immigration policy. Let them do their job. Let's do our jobs, which is protect the citizens of Toronto. And the citizens of Toronto is everybody that lives in this city.
Okay, does everybody understand the amendments that are being moved? Councillor Barlow. Any other speakers on the matter?
I wonder if I should speak, being an actual Police Services Board member. I had intended to speak at the opportunity for non-members, but I was speaking to someone in the audience when I discovered that a lot of deputants were not here, and you were done and hearing a motion. I'm offering to speak. Let's put it that way.
Well, Councillor Carroll, your wisdom is always welcome. I may not agree with all of your wisdom, but certainly you're free to speak.
Well, it's just to assure you, Mr. Chair, that what staff promised the last time that the deputants were here, meeting with police did happen. It was with Deputy Chief Federico, who has carriage over any of the outfall from this item. And there's been a switch there, and he's now the guiding deputy chief over all of the divisions where these sorts of things roll out. So that's an interesting change at this juncture, and it's and I think an important one, because you want to see this actually make its way to the ground. I actually had a perfect amount of comfort with the original recommendations that are before you from staff at this point. Key is the information that the community is looking for. We just don't have it yet. And because that meeting had not taken place, this has not been on the agenda of the board yet. It does need to be, and at that time, some of the motions that Councillor Mihevc is moving may well be the logical conclusion. when I hear the nuances around arrest and warrant for arrest, I don't go right to the, well, what about if a person has been involved in a murder or a shooting? I don't go all the way to the extreme examples. I try and look at the broad range of examples. And for me in this one, the key one, the one I want to know that someone could feel safe and have access without fear to the kinds of supports you get from police officers do sometimes go to those being arrested. And I guess what we're talking about is human trafficking in the sex trade. I'm not talking about murder necessarily, but if you're being arrested, and let's remember that arrested doesn't mean proven guilty, it means you're being arrested. And the reason you're being arrested has to do with human trafficking and the sex trade. Well, if we ask right then and put you on a plane, then I guess the thing your oppressor and pimp has been saying all along just happened. He said, don't tell on me or you will be deported, and we're now making it happen. That's the thing we're trying to avoid. Let's be very plain here. That's what must stop if it is happening. The question is, how do we get to the heart of the fact that that is happening or not happening? And that information we don't have now. Currently, the law is that you don't ask and you don't tell if there isn't an immigration warrant out. That's what we know is the language. What the deputies have told us is, but more than that is happening. It is being reported more than that. But since that isn't policy, that's not the thing you're likely to enter into the database. So we're going to have to use other means than simple database to track whether or not, and that may mean looking in a lot of officers' memo books. Luckily, they're all digitized now and entered into a system. So this is going to be information that takes a long time to find out. And the one thing missing from the motion that therefore the Police Service Board will then probably want to add is, how does this make its way to the police college so that the training is a more full training? And it does dovetail at that point with the training that we know now has to take place for Minister Nackby's provincial policy on street checks and what was formerly known as carding. Along with rights and receipts, we'll now have to reinforce your rights with regards to these things. But the board is committed to getting to a point where police officers are the guardian of not only your safety, but your rights. And so this will logically go alongside that training. So while I'm comfortable with the staff recommendations, just to preview for you, the more nuanced language that Councillor Bailão is using in her amendment is more likely to have this speed its way onto the agenda right now, because it's asking us to weigh the pros and cons, which leaves us the ability, maybe we want to retain our own lawyer and go to work on this in a more deep way, to develop the policy that basically ended up one day being the province's policy on street checks, which is rights and receipts whenever I'm being whatevered by a police officer. That nuanced wording allows us to do that along with the first time this is on the agenda, and then add to that whatever advice we get from deputies that go to the police board that day. Yeah.
Thank you, Councillor Carroll. Any other speakers? No? I would just simply ask that what we're going to do is we're going to take the amendment as part of my very short briefing comments. I'll be supporting an amended number 2 and 1 and 3 as is. I will not be supporting 4 or 5, so I would ask for the votes ad seriatim. If anyone wants a recorded vote, that's fine. I'm not asking for a recorded vote, but I am asking that 1 through 3 taken as a block after the amendment is voted on, and then 4 and 5 voted ad seriatim. 2 motions I will not be supporting. So let's put the amendment, Councillor Bailão's amendment, on the screen. Do you want to? Oh, you would like this recorded? Oh, okay. I asked for ad seriatim, but you're asking for a recorded vote, and that's fine. That's in order. All those in favor of the amendment on the screen? I guess it's unanimous.
Counselor, all in favor, Counselor Burnside, Counselor Cole, Counselor Fletcher, Counselor Pasternak, Counselor Bailao, and Counselor Mihevik. Carries unanimously.
Okay, so that was the amendment, and now we're voting on items 1 through 3. We'll take as it a block unless anyone wants those broken down. And we can ask for a recorded vote on that. All those in favor?
All those in favor, Counselor Burnside, Counselor Cole, Counselor Fletcher, Counselor Pasternak, and Counselor Bailao. Counselor Mihevik in favor. Unanimous.
All right, number 4 on your sheets. All those in favor? We'll do a recorded vote.
All those in favor, I'll start at this side. Counselor Mihevik, Counselor Bailao, Counselor Fletcher. All those opposed? Counselor Burnside, Counselor Cole, and Counselor Pasternak.
This is on a tie.
Motion is lost on a tie.
Okay, number 5. I don't have to break out A and B, but if another member of the committee wants to, that's their prerogative. We can vote on that separately. If not, we'll take 5 A and B in one vote. All those in favor? A recorded vote, please. Yeah.
All those in favor, Counselor Mihevik, Counselor Bailao, and Counselor Fletcher. All those opposed? Counselor Burnside, Counselor Cole, and Counselor Pasternak. That loses on a tie.
Okay, the item is amended. All those in favor? That is carried.
Debutant there. They're still here. We have debutants here. This one's done.
8.6, we have a deficit. Okay, we're on item 8.6. We do have deputants. Comprehensive review of state of community-based sector. Rob Horwath. Thank you, Mr. Horwath. You have 5 minutes.
Thank you. Good afternoon, committee members, and thanks for this opportunity to speak to you about the proposed comprehensive review of the state of the community-based sector in Toronto. So I'm speaking on behalf of Toronto Neighbourhood Centres, which is an association of 31 nonprofit agencies located in neighbourhoods across the city. Toronto Neighbourhood Centres enthusiastically welcomes this proposed review and looks forward to assisting the city with the sector engagement and research tasks needed to carry out the work. Working with Social Planning Toronto and a number of other community agency networks, we believe it will be possible to connect effectively with the diversity and breadth of the community sector in our city. This call for a review of Toronto's community-based sector comes at a critical moment for our sector and our city. Many community-based organizations in our city are facing extremely tumultuous times. Growing economic inequality and exclusion felt by more and more community members is generating pressures to respond to deepening and more complex community challenges. Numerous shifts in emphasis and approach by foundation and government funders are being implemented at present with little attention to their cumulative impacts and unintended consequences. And as with all areas of society, from individuals and households to our governments, people are being pressured to magically do more with less. For the sector, these trends add up to significant pressures towards consolidation and amalgamation, the hollowing out of administrative capacities that are needed to sustain healthy organizations, and in some cases, the loss of organizational viability altogether. At stake is the capacity of the community sector to make its unique contributions to the well-being of our city. And these contributions go far beyond the mobilization of volunteers and the delivery of critical social services. These contributions, as evidenced by some of the discussion of your other agenda items today, include the sector's role in civic engagement and inclusion, the building blocks that help to generate people's sense of shared purpose and democratic practice in their communities and society. They also include significant economic impacts, as we are one of the fastest growing sources of employment in our economy. We are a mechanism for broadening community members' access to economic opportunity, and we're a strategy for growing and stewarding community assets. And these organizations are also the creative glue that connects the people who are passionate about improving our city, the private and public resources needed to make a difference, and the community's can-do energies to turn vague opportunities into results. The most recent example being the impressive Under Gardner initiative and the settlement of the Syrian refugees that you've discussed today. Our city needs a thriving private sector and a public sector and a community sector. These are the three legs of our community building capacity. But the full scope and impact of the community sector on the well-being of our city is not actually well understood. For many, we are seen only as the provider of residual services to help those who have, quote, fallen between the cracks. For others, we are thought of as a mechanism for delivering services, but not as partners in co-creating and planning them. And for many people in our city, the value of our sector remains pretty much invisible, I would say. So we welcome, we know at the provincial level, for example, that the sector comprises 46,000 community organizations, that there's almost 1 million people working in the sector, full-time and part-time, and 5 million volunteers engaged in the work of the sector each year. And that the sector as an economic force is contributing more to the GDP of our province than many other sectors, including retail, food and accommodations, food services, and car manufacturing. So we welcome the city's review as an opportunity to highlight the roles of our sector across its and assess its overall health and determine how the city's investment and supports can be best mobilized to sustain our sector's unique and invaluable contributions to the life of our city. So thank you for setting this in motion.
Thank you very much for your remarks. Any questions for the deputant? Councillor Mihevc.
Yes, thank you very much. I just want to play a little bit of a devil's advocate. What do you think we're going to find out that we don't really already know? And maybe the second question, you can do it all at once, is don't you think this is a sector that is already overly viewed and reviewed and audited and made more efficient? Isn't it time that we just say, you know what, this needs more support? That's the conclusion. We know the conclusion.
I would welcome more support. That would always be a good response on the part of the city. There is definitely more to be done in that way. I do think we still have a lack of understanding about what some of the missing pieces are in our sector and how extensive it is in the city. We can't actually talk about it in the same way we can with those provincial numbers. We don't actually know what scale it's operating at in the city. We don't know how many are employed in it. We don't know the sort of, we can't tell residents about the breadth of it very well. And I think there are a number of overlapping trends going on that aren't well understood about how they're impacting on the organizations. We know with the settlement services and some of the cuts with the federal dollars that there are cuts to programs, but there are also other ways that dollars are being reshaped that are having making a challenge. So for the city to make smart investments and figure out whether by neighborhood, whether that's about greater ability to connect or the need for an anchor organization hub or the need for more community space, and to have that kind of nuanced analysis for investment, to guide investment, I think that's still missing. So I would like to see that, and then I would like to see that lead to greater investment, but I think it would be a great tool to have to guide smart investment.
Any other questions for the deputant?
Just a quick question. Should we also tie that metrics with our strategic goals and see how the nonprofit sector is actually helping the city attain its strategic roles and the contribution so that we actually see our investment measured in relation to our strategic goals as well?
Sure, I think that would make total sense. I would love to see more of a co-deliberation and planning and assessment by departments, especially those that are deeply connected with the nonprofit sector around childcare, employment services, recreation. All of those are are areas that the city is directly involved in and also the sector is involved in, and it'd be nice if we had ways of measuring impact together.
Any other questions for the deputant? No? Thank you very much.
Thank you.
Pedro Barada? Vice President, Communications, Public Affairs, United Way. Thank you very much for coming. You have 5 minutes.
Thank you very much for this opportunity. I am here to also encourage the city to move forward with this comprehensive review of community-based services and to offer United Way support in this endeavor. A couple of weeks ago, Council did something historic, which was to endorse a poverty reduction strategy for the City of Toronto. I think it's fair to say that this committee holds most of the cards in terms of the winning deck and in terms of moving forward on that poverty reduction strategy, and a key trump card in terms of us actually achieving that level of poverty reduction is a healthy, thriving, vibrant, community-based sector. Community-based sector are key partners in terms of helping the city achieve its goals from a life cycle perspective. Every day across our city, in every neighborhood, in all of your wards, there is a door to community-based services that's doing prenatal services, helping kids, helping parents, engaging young people, helping people find their first job and their next job, helping people who've fallen out of the labor market, helping people who are seniors. In many ways, the community-based sector is looking both at prevention of poverty as well as how we mitigate against some of the impacts. And I think it's doing a pretty good job. But our communities are facing increasingly complex needs. The nature of the labor market is changing dramatically in our city for more and more precarious employment. And the people who are lining up for services, for community-based services, are increasingly both working and poor. Our city is increasingly diverse with many diverse needs. Housing is an issue. People are seeking increasingly complex supports, and it's difficult for the community-based sector to keep up with the growing demand, with the growing complexity, when the pie is not growing, when the sector is being asked more and more to deliver impact, when it's being asked to be nimble, when it's being asked to report more, and at the same time when no additional supports are being provided. I'm saying all of this not to say that the sector is not able to respond. It's actually a great site of innovation. It's actually a great site of impact. But I really want to get across that the sector is looking forward to an opportunity to take a step back and to ask, how are needs changing in our city? How well are we doing collectively in terms of addressing some of these needs? And how can we work with the city and with other partners to really be able to have a better impact? Taking this step back, I think, is key. The timing couldn't be better. The City of Toronto has taken an amazing step on poverty reduction that matches with the an existing provincial framework, and now with an emerging federal framework. So we have alignment at 3 levels of government, which should be celebrated. Other organizations, such as United Way, are also undergoing a similar process of taking a step back and asking, changing times, a sector under pressure, how do we build for the future? And how do we define a vision for the kind of city that we want to see and align our investments and our partnerships against that vision? We have a great opportunity to not just keep doing what we've been doing in the past, not just keep replicating all of the things that got us to where we are now. I think it's time to take it to the next step, and we would love to see this comprehensive review as a step in that direction. We're here to provide our expertise, to share the results of our own review, and also to help connect city with residents and the sector as you move forward on this, and I would encourage the city to move forward on the comprehensive review of community-based services. Thank you.
Great, thank you for your comments. Any questions for the deputant? No? Great, thank you very much for coming in and sharing those views with us. Questions for staff?
I can't remember if I read this in the report or not. Do we have a time frame of how long this review would take?
Through you, Mr. Chair. So we will be starting the review as soon as possible, following council deliberation, with a time frame to report back in June of 2016.
Thank you.
Just a couple of quick questions. There's actually a reference to prior to the 2017 grants funding cycle, so it would not be in 2016 grant.
It will have to be in 2016 to meet that objective, so.
Your work will be done, but it will not affect the 2016 grants.
Correct. There won't be an implication for the 2016 grants. We would be doing it in time for the 2017 cycle.
And I guess in general, the process is creating higher levels of standards and search for excellence and just doing things better and working with our various partners to achieve those goals.
Yes, that's correct.
Okay, great. Councillor Mihevc.
I'm just wondering what the origins of this report is. Where's it coming from?
So, through the chair, there were a number of directions to staff to review the investment grant program, to review the below-market city space policy, to look at how we can better support agencies that are experiencing management challenges. And when staff looked at all of those directions, it became clear that perhaps there's a broader exercise that would be helpful, and that's the frame for this report. It's just that some of the broader questions that the two deputants touched upon will be more appropriately managed through this.
Okay, thank you.
Any other questions for staff? Councillor Cole?
Thank you, Mr. Chair. Through you to staff. In a localized perspective, one of the things we find obviously is that not all organizations are created equal. Some are high functioning, high capacity, some are not, and there's a need for maybe some transference and sharing of knowledge and experience. And I'm wondering if that will be touched on. The other question I just have is, to be frank, in some areas, I find there's a lot of overlap of similar services or service providers providing, say, to one demographic or one, geographic area, whereas then there are other gaps that aren't being covered. Do you see any analysis of kind of that phenomenon?
Through the chair, absolutely. There's an opportunity to take a systems view to address some of those challenges within the system. I think the sector itself, I think, is interested in that conversation to figure out how we can be utilizing resources in the most effective way possible.
Thank you very much.
All right, speakers. You'll move the motion? Okay, Councillor Havoc is moving the motion. All those in favor? It's carried. 8.7, options for 702 Kevanee Road. We have deputants Marika Good. I hope I've said that right. Thank you very much for coming. You have 5 minutes.
Thank you very much. The name is just plain good. So.
I apologize for that.
No. It's okay. I'm here to speak with you about an additional option for 702 Kennedy Road, which is the home of the Second Base Youth Shelter, and that is to save that shelter. It is existing, it is fully functional, and despite all that we've heard, it is financially viable. We started a petition, and to date we have 4,313 people who have signed it, and a lot of personal stories are here, which I'd like to get to after I tell you a little bit about myself and my involvement with the shelter. I was a volunteer at Second Base as a human resources and business consultant, attending the executive meetings in 2009. I stepped in as the manager briefly when there was a gap and learned the operation. I then became a volunteer board member and elected as chair in the fall of 2010. I stepped down from the board when I was asked to step into the role of the executive director in February 2011, when our then ED had taken leave. I found many inefficiencies. We were in debt without a penny to be found. We were locked into contracts that were too expensive and didn't make sense. I was able to renegotiate these to fit into our budget and current practices. We had 3 bedrooms that were closed, and they were designated for heater repairs with an invoice of about $12,000. When I asked for other professional opinions, I found that the repairs could be done for about $1,200. There were contractors doing work that had close personal ties with the old management that were released, that we released immediately from our vendor list. I found that checks were being written without any regard to bank account balances, and were going further into debt with NSF fees. They were stacking up. There were physical building deficiencies that needed immediate attention and repair to satisfy codes such as fire codes. We engaged the community to help us with volunteers to cut down costs. We had groups that came in who cooked meals and spent quality fun time with the youth. We rejuvenated the shelter and engaged the youth and community to help us with painting the bedrooms, and a wonderful organization called WINK organized a complete redesign of the main living and dining common areas. The donation of time and materials was valued at upwards of $75,000. We had a stabilization plan and a vision for the future of Second Base. We had 2 like-minded programs that rented space in the basement and helped pay our bills. We paid off $150,000 in back debt and put $200,000 in the bank account, which was the building of our emergency fund for the shelter's future viability. I found many inefficiencies. We were in debt without a penny to be found. Oh, sorry. This thing, excuse me. So the shelter was in the black, financially viable and stable when I left in April of 2012. And that's the point that's really important here. We did a lot of work, both in the community, with the funders, with the staff, with the youth. We changed a lot of lives. The shelter was financially viable, the building was stable, and the operation was sound. We're willing to put our heads down and work through the issues and challenges to resurrect Second Base. The infrastructure still exists. The bank is comfortable with our leadership. The funders remain. The community is engaged and the staff are available. My last paragraph is, the shelter remains a strong, viable shelter today. In fact, the corporation is still paying management salaries and third parties for services, and are up, keeping their, and they're keeping their debt load up. So they're not in default of anything. And I can only imagine that working in that empty building as these managers.
If you could, you're at 5.5 minutes, if you could wrap up.
Yes,
That'd be greatly
the silence
appreciated.
must
Thank
be deafening with no young voices carrying on. And I was going to read some stories, but I will refrain because, thank you, I'm over my time.
You know, if you want them distributed to committee members, certainly they can be left with the clerk, and they can be distributed as part of this item.
Fantastic.
Great. Well, thank you very much for coming down. Any questions for the deputant? No? Thank you very much. Michael Voudrakes?
Barakis. He had to go, I'm sorry. He was here this morning.
Okay. Colin Dew? Thank you very much for coming. You have 5 minutes.
Thank you. Good afternoon. I know it's been a very long day, and I did have a speech prepared and my paper and everything, but I debunked that. I am a 23-year veteran of Second Base Youth Shelter, a former staff. I am here to speak to you from the heart and not to speak to you from paper. The shelter has been closed since October 1st. That's a 60-bed shelter that has been closed within this region of Scarborough. I am a resident of Scarborough. I am a taxpayer of Scarborough. And I know the last report that just came out from this committee claims that, you know, in 2016, they will be looking at building another youth shelter within Scarborough. Now, I have a question for this panel. Why build another youth shelter in Scarborough when you do have a structure that is viable, that is standing, that is still intact, all chattels and everything? The winter months is around. I have been there. I know. I have seen. I know. There are 60 beds. We are suffering in this city, and I know the youth have been replaced or displaced to different shelters, but that's just overburdening the other shelters that exist within the city of Toronto. We're talking about Scarborough. Scarborough has no youth shelters. Yes, there's a men's shelter. There's a family residence, but there's no youth shelter in Scarborough. We're talking about homelessness in the heart of winter coming up, and you have 60 beds in Scarborough that is being closed and just being maintained presently by the executive board and the directors. There's no staff, there's no youth, the doors is shut. Why then is this panel or the ORDC, why then are you guys thinking of building another shelter when we already have an existing facility? I don't understand it. And, you know, and the youth that we service within Scarborough don't understand it. The residents don't understand it. The taxpayers don't understand it. So I am here speaking from the heart. I am a parent, I am a grandmother, and I don't know years to come, or 2 years or 3 years, if my grandchild will not need a space to go for whatever reason, a dispute at home. I don't foresee them traveling all the way down to downtown to Covenant House or other places to get facility or get the services that was once so viable within the realm of Scarborough. I am here pleading to you to reconsider opening up back Second Base and giving us back a viable service within Scarborough. We need the service. The statistics shows that the service is there. The city talks about a 90% capacity, you know, for housing. We supersedes that right there in Scarborough. I have seen the need. I have worked with the youth, staff. We have been there. We know. We have been there. Take it from me that someone who has worked with these youth and in Scarborough at Second Base for 23 years, and that door is shut, and that shelter is just sitting there, and then you're looking at building a shelter in 2016. What about the interim? What is going to happen now? I've seen kids or, you know, individuals miss what is happening to the winter is coming. I just got kicked out of the house. Can I come and stay with you? I brokenheartedly have to say, I am sorry, but my house is full. Yet still, you have a shelter, 60 beds, with all the beds and all the chattels are just sitting there. I want the City of Toronto to stand up and this council to take a deep look at what has happened at Second Base within the last 3.5 years, but more so since 2015, October 1st, and look back at it. Thank you, and thank you for hearing me.
Thank you. Thank you very much for your comments. Have you seen the copy of the report before us? There's some information in there.
Yes, I have.
You have. Any questions for the deputant? Yeah, Councillor Fletcher.
The report that we have suggests that there may be other providers that could operate a shelter. But you specifically are very concerned about youth in Scarborough and the lack of a physical shelter space for them over this winter. Am I right?
That is correct.
And we did hear that Second Base had a number of internal problems and was unable to continue for whatever reason. Did anyone ever from city staff ever interview you or anyone you know to determine what had happened at second base?
No, and that request was made to city staff, the ARO, and, you know, whoever would listen to us to say, can you please talk to us? We are stakeholders, we're here, we can help, we want to help. And it just falls on deaf ear.
And as this was going through its difficulty, as second base seemed to be going through difficulty with its board, and however, when the board came to that decision, you had volunteered to give information about what you saw happening there at second base?
That is correct.
To whom?
The ARO,
What's an ARO?
the agency review officer.
The agency review officer. So, and you were there for how long?
23, this would have been my 23rd year, come December 1st.
You were at second base for 22 years. This are 22 3/4 years.
That is correct.
And it was clear to you that there was a crisis in management at this location?
Yes.
You offered to speak to the ARO, and nobody was interested in speaking to you?
No.
Is that the case of anybody else that you would know there? That offered to speak, that maybe somebody's behind you and they might make a deputation today and let us know what happened there. And what point did you offer to give your insights as to what was going on at this center?
In particular, 2014, August, the shelter was closed temporarily for 2 weeks. And we were just, the staff body and the resident were only notified to say, by the way, the shelter will be closed to restructure or to do some other stuff. And we all voiced our opinion to say, why close for 2 weeks? What's going on? We were told it was because of gang affiliation cleaning up, and it has nothing to do with finances, and to repaint the room and stuff like that, and volunteers were coming in. We said, but there's more to it. I personally said there was more to it than what you're presenting to us that's going on here. Listen to us, talk to us as a group. And why close the shelter then for 2 weeks? There's other way of resolving these issues for painting or doing the minute stuff that was going on staff training. There was like an insult to staff training. It's like retraining, but we always welcome new training. There's ways around doing stuff so we can not cause a disruption to the service and continue with the services. No one came back to us or listened to us or even say, as a group, what are your ideas? What, you know, since you guys are veterans here, what are your ideas? What can you put forward? We are stakeholders, just as much as the resident, just as much as the city, just as much as the councillors, and as citizens and as taxpayers, we are just as much have a say and an input. We voice those opinions.
Thank you. And as I understand, you said there was some gang-related activity? Was that something that...
In the form of graffiti.
Oh, graffiti, okay. And is it true that this is, there's 2 different gangs operating in this area, and that was having some, second base was creating some problems?
There was, the gang, as we know it, you know, they transitioned from one location to the other. And yes, there were some times when, you know, there would be different ones that come into the shelter and mark their turf and mark their territory on the rooms or, you know, specific areas. So the city brought in, we were told by the ED, the gang awareness came in, they came in, and we got retrained of how to identify and how to de-escalate in that situation. That was very welcoming. It wasn't like a huge catastrophe, but it was identified, yes.
Thank you.
Great. Any other questions for the deputant? No? Thank you very much for coming in.
Thank you.
Nathan Hammer? Thank you for coming in. You have 5 minutes.
Thank you for having me. I just want to say, since it is a limited amount of time, quite frankly, it's my opinion that you guys have not been given the full picture. In fact, you've been lied to. I believe instead of seeing it as a negative thing, which it has been up until this moment, we're actually at an apex where it can turn into a positive thing. If you look at the past of Second Base Youth Shelter, anytime that we have fallen into any perils, it is because of the upper management. You may not know that Second Base has run several times without an executive director and even without a manager. It's one of the only shelters that has a very low turnover rate. So I'm a newbie, but I'm 11 years at Second Base. The previous staff that spoke was 22 years. And so it can run even autonomously. So let's get to the numbers. Since you guys have been lied to, the numbers normally tell the truth. Second Base, since 2012, has been running at 90% capacity or higher. Second Base, it is disingenuous to say or consider it as a youth shelter, just another youth shelter in Toronto. It is the only youth shelter in Scarborough. It has 60 beds, and again, it was operating at 90% capacity. So when these kids were asked to leave, in fact, told to leave, and told to leave last minute, there really, quite frankly, are not enough beds to handle these youth. These youth were told that they would leave on October 20th, but actually were forced out on October 1st. Many of them forced to sleep on a couch and were considered to be housed. Again, this is part of the lie that you were told. Going forward, again, the numbers, based on the per diem, based on everything that was already in place, has left Second Base in the black. You were told that Second Base had issues, and they did have issues, but the issues primarily were with the executive. And you don't need to take our word for that, because the Scarborough Police themselves have been on record and have said that they have issue with the executive director and that they don't understand some of the decisions that were made, but they are in support of the staff that are there. So now this is my question to you. I really don't understand why a youth shelter that stands, with a principal building that stands, would be shut down without any clear plan as to what specifically is going to be done with it. All this time that we are talking and deciding on what we could do, there are kids that are homeless on the street every day. This discussion could have been had while the kids were housed. That being said, again, let's look at the numbers. We're trying to consider selling a property, a facility that currently has a binding agreement with the church that shares the same land. So you want someone to come and purchase this building knowing that in 2035, I believe it is? Thank you, 2032, that building has to go back to the church. So you're buying it and you will not be able to retain the property. I also have a business of my own. And if someone were to sell me a property and say that I can purchase it, but that I have to give up that property and not regain any of my funds back, that's a horrible lease. So I don't see how you're going to get anybody with those funds to do that. Let's look at reality. Right now, this shelter is running. Is not running, but could run. Today, if you guys opened it, there's already staff in place who know how to run the shelter autonomously until you can find yourself an executive director that you have faith in. There are already youth who have a desire to stay there. There's 40,000 people within the community, including the youth and other people, who wish to see this shelter open. We do not understand why it was closed. We have it on good authority that the shelter is in the black. They are not in debt to anybody, which is another lie that you were told. So I'm, in short, asking that council give an earnest look at the true picture of Second Base. Look at the financials. Do not take what has been submitted to you as gospel truth, because I guarantee you, if you look hard enough, if you look at the bank that has the mortgage, if you look at anything, any other shelter, the same type of debts that they would have, look at Second Base and see if they are in the red and they are in the black. And if you find that they are not financially stable, make the right decision. But if they are, please open the doors and give those youth a bed to sleep in.
Thank you very much.
You're welcome.
Questions for the deputant? Councillor Cole?
Thank you, Mr. Chair. Thank you for the presentation.
You're welcome.
What are the, I guess, previous now permanent staff doing right now? I'm not sure how many of you there were, but where are you all now? Just kind of in limbo?
So, no, the staff the shelter is closed.
Yeah.
So the staff no longer work at Second Base, or they're not supposed to, although some of them are still waiting for their payments, so that is where the limbo is, because normally after a closure, you would have approximately a week or so to be paid. That has not happened. I can only guess as to the reasons as to why, so that's the limbo that we are in. But again, the majority of the staff, for the sake of the shelter, are willing to come back, at least in the interim, until a solution can be found.
Yeah, and so you kind of answered my next question a little bit. I would imagine other people have tried to find different work or moved on staff-wise, but your sense is that of the bulk of the staff would kind of come back if an opportunity were provided?
Definitely. To answer your question, the bulk of the staff have been arguing to be heard and to have what we believe is the truth to be heard. So many of us are still in contact with each other and would like to see the shelter open and would work again upon request.
Okay, thank you very much. Thank
You're
you,
welcome.
Mr. Chair.
Thank you, Councillor Cole. Any other questions for the deputant? Councillor Fletcher?
So you worked 11 years at the shelter.
Yes, ma'am.
And you, did you offer to give some feedback on what you saw happening at that point around, are you telling us that things weren't being well managed or that there seemed to be a bit of a crisis in the management of the shelter? Did staff notice that?
Yes, definitely. Not myself solely. All of us at different times, I feel, have voiced these concerns. Like you've heard prior, there was a 2-week time period when the city actually gave us an ear to our concerns, and we voiced them, and we were told that they understood what the true problem was and that they understood that this is an upper management issue. So we were very hopeful that change would come and that at least the people who are making the decisions will be held accountable to their decisions, and that was not forthcoming.
Sorry, you said that the city told you that they closed the shelter for 2 weeks?
The city closed the shelter for 2 weeks so that there would be retraining and so that they would be able to take a closer look at some of the issues that Second Base was struggling with.
And that was in August of 2014.
Yes. May I speak on the question that was posed in regards to the gangs?
Sure, let me ask you that.
Sure.
That's my understanding, that there was gang activity and it had become very dangerous at Second Base and maybe wasn't being handled well.
That is true, but not of our current time frame. So within, and it's not only exclusive to Second Base, within the youth shelter populace, you'll find that things have changed from being more behavioral and dealing with harder gang street youth, and you're dealing more with mental health and other types of behavioral issues. And that is, like every other shelter, that's what Second Base is seeing. When Tavis came in, which is a specific police force that was set in Scarborough to deal with gang issues, especially in that area, Appleworth being the one across the street that had the gang that was giving us the most issues. They came and they pretty much dismantled the gang in that area, and that happened, I believe, 2 years ago. So when we're talking about present time, we're not talking about gang issues. Again, when they said gang issues, they were talking about graffiti, which many times meant, you know, my name's Nathan, so it would be like saying Nathan was here, Nathan slept here. I don't think that's honest when presenting that as uncontrollable gang issues.
And did you read did you have a chance to read the financial statements online?
I have been able to briefly look through them, yes.
Haven't.
I have.
You have?
I have, yes.
Did you not notice that there's a fairly large outstanding liability?
Yes. All I can say is we have it on good authority that those numbers are not the most accurate, and I would ask you guys to look into them. As I've stated before, Second Base is currently in the black and is not in debt. And I would, sorry?
So do you understand where the actual Second Base board and governance is? Has it, what's the word, folded yet?
It's my understanding that some of the board members and some of the executive are still in place, and some of them may even be still being paid.
The legal situation of the board itself, of the corporation?
The board.
I'll ask the staff and find.
Oh, sorry, okay.
Yeah.
What were you asking me?
Pardon me?
Sorry, were you asking me
I
something?
did.
or-
I asked you if you knew about the legal situation, if the corporation was still in place or not, or if it had been,
I must say that's beyond my,
Resolved.
that's beyond my wherewithal right now, I don't know.
but we'll find
Just-
that out.
Yeah, just a reminder, what's before us is the future of
I
the
understand. and
property,
these
not...
folks are asking us to
Right.
to
not
make the future second base. They're here requesting that.
They are, but what's before us is
I understand that.
you've seen, okay.
I have, but we're hearing information
Okay.
today about youth.
And just to reiterate, I know that there is, there's something that has been put forth, but a lot of these agencies that we're hoping would purchase this property and run it, one, again, I don't think any of them will purchase the building knowing that they have to turn the building over and not retain any of the funds that they used to pay for it. But as well, I don't really see why closing it and reopening it makes any sense when it's solvent and it already runs even autonomously. And you don't have to take my word for that. It has run several times without executive. So as we're sitting here, waiting for somebody to come and purchase the building, kids are homeless and it's now winter. And again, I ask, what is the purpose?
Right. And were there a lot of kids of color in that shelter from Scarborough, or what was the mix? The rate?
I would have to say that the populace inside the shelter would reflect that of Scarborough. It was mixed, definitely, yes.
And the staff as well?
Yes, definitely,
Both.
yes.
Thank you very much.
You're welcome.
And waiting today. Appreciate that.
Thank you for acknowledging that.
Any other questions for the deputants? No? Thank you very much for your insights. Solange Balouz? Thank you very much for coming. You have 5 minutes.
Yeah, I won't be that long, actually. I'm a current board member of Second Base Youth Shelter, but I'm here speaking as a board member, not as a vice chair, because I just happened to be in the neighborhood when I heard that this issue was taking place. So I'm not prepared, but I just want to share my point of view as a relatively new board member. I joined the board members of Second Base about 1.5 years ago because I was interested in volunteering and helping the youth of the city because of my involvement in having dealt with a lot of youth that were couch surfing, so my heart was for the youth. And as someone who has been involved in several boards in the city, work in the provincial government, I figure I can give my time. When I got a Second Base and looking at the financials in the institution and talking to city staff, we realized that we had an agency that was in difficulty for several years and that has been pretty much living off of a debt that was based on the building. I mean, there were some issues, and I was actually surprised to hear the former staff mention leaving the agency in a good position. Second Base has been an agency in difficulty with the City of Toronto for 7 years, both in terms of the finances as well as the practices, the graffitis, the gang-related activities, and all of that. So last summer, working with the City of Toronto, we decided to put a pause, and a lot of us members were new, and we've been involved in other agencies, and we thought that was a very awkward situation to have an agency dedicated to serving youth and not really doing what it's supposed to do, whether it was the per diem issues or the liability issues, the gang-related issues. I mean, there's so many issues. So we put everything in pause and worked with the city and the police to get some staff training, to look at the finances, to talk. We kind of say, well, let's pause it for a minute. And after that, again, I'm going quickly, we realized that really the way the shelter was being managed, run, and the whole process was not really a good use of city funds, employees' time, directors' time, and some of the concern that we had from the community at large. We attempted to reach out to the councillor in our area. We called for several meetings. There was no response. But working with city staff, we figured, well, we're going to look at our funding and see how we can roll this out. Ultimately, I have to say, I volunteered because I was concerned about the youth. So as we were seeing that financially and operationally, in terms of accountability, was no longer viable, we attempted to see if there are agencies in the area that could accommodate the youth, which we've done. And we had a report that we produced to see what was happening to the youth that were there. Some of the data, and I'm sure the board can provide, we look at the female-male ratios. A lot of our female beds were staying empty because the female residents were concerned for their safety. So there are a lot of other issues. So in fairness to the staff and everyone who spoke before, that's why as I was listening to this discussion on my way back from Niagara Falls, I decided to stop just to maybe have the city and the committee to kind of pause and to look at this matter, having this conversation without consulting the board. The staff who were here, they had our chair's contact information. A lot of these individuals never really reached out to actually see what was happening. So I really don't want the city to look at this in a vacuum. So I would stop here if you have any questions, but all I have to say is when I got involved because I wanted to help the youth, not to provide an organization that is not accountable, that is not fiscally safe or sound, and ultimately the youth were the one that were being affected. I don't know if you've seen on YouTube, we had a situation where youth were being harmed in our shelter, and that was unacceptable, having staff. So there's a lot of issues that were there. So I just don't want us to, discuss this issue in a vacuum. I think that the city staff has been very helpful working with us, and we've worked with the police, we worked with other departments. It's just that at the end of the day, we as a board, being citizens of the city and sitting there on the board, we had to make that decision. Thank you.
Thank you very much. Any questions for the deputants? Councillor Fletcher?
I just heard you say, thank you for coming. Why, the way it was being run was not good use of city funds. Now, this had been a shelter that had been run for decades.
Yes.
What do you mean by that?
Well, it's like when you look at the numbers and look at the per diem and our per diem and our the number of youth that we have and the salary cost that we incurred, whether it's through pay equity or through other means, and the expense that it took to run the city, we just did not have the funds. We had a fundraising committee that we established, and I have to say, I like to hear when people say that they're really concerned about the youth. Whenever you do fundraising to raise funds for Second Base, we had very low attendance to those events. So even our staff, some of them didn't even participate in the fundraising for the whole shelter. So it's great to show compassion, but the reality is that when you look at the numbers, especially given that the issue was that even if you have vacancy in girls' beds, because they're afraid of their safety, you're going around in circle because they're not going to come. So ultimately, if you have empty beds, and I know the city staff at some point ask us, well, how come you have empty beds? If the empty beds are because there's a safety issue, then we're going through this circle of. So yeah, I have to say that when you look at the numbers, the per diem that we're receiving, the cost of running it, the books were pretty much, I mean, almost every month we had to come to the city to see if we can keep the light open. And the city helped us at time by giving us some top-up, but it was really a struggle. And when we asked the city, as new board members, they told us that, well, this has been a challenge for several years. So I don't think this should be a surprise to anyone.
I noticed you mentioned fundraising, and I looked on the website, and I would agree there was very little fundraising that was done. Did you have a professional fundraiser that was out getting corporate dollars, or were you just holding events?
Well, yes, this is the catch-22. We had a couple of professionals that I was the chair of the fundraising committee, so I actually had a group of people. I mean, I joined the board a year and a half ago. We had a fundraising plan that we developed.
And how much did you raise?
We raised, I think, five. We did the coldest night of the year. We did Giving Tuesday, and we raised about 5,000. But the thing is that the turnout, even if we were trying to, was not as we expected. We had a coldest night of the year in Scarborough, and we had about 10 people participating, or 15, and 10 of them being my friends. It's ridiculous. So at some point you're thinking, well, if people are really concerned about the youth, they should turn out when we do these fundraising events. So I'm just saying.
What kind of board training did you get as a board member when you joined?
Sorry?
What kind of board training did you get?
We had the usual orientation with going all our policies, the manuals, and we had several sessions that at time were organized through the United Way that, board member were to be able to attend. I myself, I've sat on several boards in the city, so, in the city of Toronto, not with the city, but some of our board members came with some experience also, so, but we did try as much as possible to, yeah.
Okay, thank you.
Thank you.
Thank you, Councillor Fletcher. Any more questions for the debutant? No? Thank you very much for coming in, sharing your views. Questions for staff?
Yes, I do have some questions. What's the status currently of Second Base? Has it been dissolved as far as a corporation is concerned?
Through the chair, the board is still in existence right now until we have finalized our financial statements.
Are you from the board or you're the,
I'm city staff.
Until you finalize their financial statement?
That's correct.
Your financial?
City staff need to finalize the financial statements for the agency.
You said our financial statements, so that wasn't clear to me, right? So I just need to be clear, you're going to look at their financial statements and finalize them?
Correct.
What's their current status? You must have done all their finances. How much do they owe? What, are they in the red? What for, et cetera? Don't count all their payouts for staffing, because that's fairly significant. What are their payouts for staffing? But people have been there for 20-some years and 11 years.
Through the chair, I don't have the exact numbers here with me, but I can provide them to you.
You don't have those, so maybe we'll get those at the next meeting. So we're really clearly understanding how we lost a fantastic youth shelter in Scarborough, the only one, gone. So you don't have their financials as far as what they're paying out. Do you have the financials as far as what was their status on October the 1st, prior to their liabilities with staff payment? Yes? No?
Through the chair, I don't have those numbers here, but I can provide them to you.
So you don't have those. Okay, and the board itself then is acting as a board, but there's no executive director and no staff. Would that be how you describe the situation?
Through the chair, there is one executive director and one staff that's working to wrap up the services and to provide us with the necessary financial statements.
I'm sorry, to do what to the services? I didn't hear that.
There's one executive director and one employee on staff currently to wrap up and close down the services, as well as to provide the city-required financial information.
And there's still a board of directors? Or not?
Correct, there is.
Fully functioning board of directors, okay? And what about one of the employees who've been there for so long? I understand from a previous report that there was some interventions by the city in order to try to figure out what had happened. Were any of the long-term staff interviewed when you were doing your workup to figure out what was going on at Second Base?
Through the chair, in 2014, when the shelter was closed for a period of 2 weeks, city staff worked with the board to identify the priorities. Some of them were staffing issues. We did work with our colleagues at SDFA to provide training as well as shelter standards training.
Okay.
Just in addition, we also hired a consultant to do additional work with the employees.
With the employees, but did you interview the employees? Because one of the questions I had last time was, what did you do in order to attempt to stop the closure of this shelter and identify what the issues are? And I'm hearing today that you may have been giving training to people that have been there for 23 years, but had you interviewed them as to what was taking place or the dysfunction which may have been in management as well as you saw in staff or board? Do you have an overview? I'll leave that question. Somebody can answer that. I heard that didn't happen.
Through the chair, Councillor, there was a fairly extensive process of support. Staff did work with the organization to understand what the issues were. Karen's just indicated that the management consultant that they were working with did talk to staff. We were aware of and working with the agency in terms of the concerns related to gang-related graffiti and how to manage that piece. Today, committee has heard from a very small group of individuals with particular experience. The entire picture is a complex one of an organization in significant difficulty with many pressures, many things going on that was not successful. It certainly wasn't directly a result of a lack of city interest and intervention and attempt to try to make it work. From a city perspective, it was a priority to try to make it work. In this instance, it was not possible.
And what is the reason, I know when we're talking about my red door, if something happens to the red door, then the city would look to replace that need in that place. And what is the reason why there is no move to replace that need, being youth in Scarborough and homeless youth in a shelter that was built for youth?
There are a number of issues needing to be resolved, such as the outstanding financials.
I'm not talking about them running it. I'm talking about another provider.
I understand, Councillor. My point is that the city doesn't own the site. The city doesn't have the ability to direct who or what operates there. And until the legal issues associated and financial issues with the past operator, it's not within our purview to undertake a call for another provider. We don't actually own the site. For that reason, my understanding is SSHA has gone ahead with a call for a youth shelter in Scarborough that would not be on site.
All right, so we're at 7 minutes. Councillor Cole.
Thank you, Mr. Chair. And maybe I'm repeating a question, but it maybe just reflects that I wasn't sure what the answer was. So I understand that what we heard today was just a small, group with a certain experience through the shelter, but it sounds like they had a staff with almost hundreds of years of combined experience. Councillor Fletcher had asked, were they spoken to, interviewed, surveyed through this process to find out, I guess, A, what was wrong, if there were things wrong, and what could be done better, not about offering them supports on the gang-related issues or anything like that. Were people deeper than the executive level of staffing consulted with by the city? Or their management consultant?
Through the chair, the second day the shelter closed in September of 2014, a management consulting group worked with the agency to provide facilitated discussions with the employees.
So that was after it closed?
To clarify, that was the temporary closure.
So that wasn't the final closure, that was kind of a shutdown to do that kind of investigative work?
That was a planned shutdown to
do that work, and that did delve down below the senior levels of the agency.
My understanding is the management consultant also engaged the staff.
Okay. Has that report been provided to this committee?
So that report would be provided to the agency, because this is a separate agency with its own board. I'm not sure if it was provided to the shelter staff.
Did the agency pay for that service and report, or did the city pay for that service and report?
Through the chair, the city paid for it.
So I would think that if we paid for it, we could have access to it? Is that possible?
Correct, we could obtain that information.
Thank you very much. Thank you, that's all, Mr. Chair.
Any other questions for staff? Speakers?
Just
So I was sorting out a motion, Mr. Chair, and then adding on that we be provided. No, okay. You know what, I'm going to defer this to the next meeting. And Councillor Cole, it's actually his suggestion. There's outstanding information here. Every time we have this conversation, we're learning more. And this is very instructive as far as closing a shelter. And it's not because somebody sold the church like we had before. This is something that seems to have crumbled. And we have some things to learn here. And I want to make sure we do, including where the next shelter is going. So this is just going to be on our agenda for a while, because youth in Scarborough is a very important issue. So I am deferring it, but I would like to ask that we be provided with the management findings, the consultant's findings on second base.
Okay. That's fine.
Mr. Chair, just to speak to deferral, I just think there are questions asked by Councillor Fletcher, especially on the financial data that we don't have in front of us. And while this is maybe a look forward, at the same time, for us to move forward in an effective, productive way, we need that information. And on top of it, I don't think we need to move a motion to this effect. Similarly, the management consultant's report that accompanied that would be instructive too. And so I support Councillor Fletcher's motion to defer, even though I'm sure for the community it may be a extension of, as it was called, limbo. I think we need to have that information in front of us.
Yeah, I would agree. This is actually probably a good case study in as you say, for future decision-making on who we get into partnerships with and what kind of rules that we make them adhere to. The fact that they're running it out of the building that they own could in itself be problematic in the sense that they may have seen dollar signs in property values, even though there's constraints on whether they can sell or not. Something to consider. So, well, why don't we put the deferral before us? All those in favor? That is carried. Final item on the agenda today is an item that's been deferred. It originated in Budget Committee, an issue that I'm particularly interested in because I'm a firm believer that the future of affordable housing in this city is not just bricks and mortars, but rent supplement programs. And there's actually a good report in front of us. Questions to staff, other than me? We lost quorum. The rent supplement agreements in all their various forms are they primarily based geared to income, rent geared to income?
To you, Mr. Chair, yes, they're all rent geared to income.
And that is mandated by provincial statute, or do we have elasticity in that?
That's actually for those programs, it's mandated.
It's mandated. Now, my understanding from the numbers in front of us, we have a little under 11,000 units and about an $88 million budget. So are we looking at somewhere in the vicinity, a little over $8,000 per household, per eligible household?
Yes, that's about right.
Now, we've deferred this. Yeah, so I can move very quickly on this. Now, anecdotally speaking, the people who are living on the edge need $300 to $400 a month. The ones that are, anecdotally speaking, the ones that come into my office, and we meet with every possible affordable housing applicant. If the average household is getting $8,000, but anecdotally speaking, we're probably half that will keep keep people off the street. Is there any way to relook at this program, to provide maybe a smaller amount per household, but we could actually stretch it to potentially 15,000 units or 16,000 units?
So to you, Mr. Chair, I think there's two answers to the question. First of all, given that the number of households in core need in the city is somewhere in the neighborhood of 220,000 people, that we need a lot more funding for housing allowance or rent supplement programs. And that funding should probably come from the federal and provincial governments. The second thing is, yes, we would like more flexibility in terms of the amounts we provide, and we've actually asked for that flexibility of the province in their update to the long-term affordable housing strategy, and we're expecting them to make an announcement early next year to tell us whether they're going to give us some of that flexibility.
So they've agreed to flexibility, they just haven't identified how flexible it'll be.
They have not agreed yet. We've asked them for it, but and they've said they're listening to us. But until we see what's going to be the update to their long-term affordable housing strategy, we don't know if they're going to actually give us the flexibility.
Is the flexibility based on the way I've described it, or is it in other areas?
It's in a number of different ways. First of all, the RGI formula, rent geared income formula, is very complicated. We'd like to just simply simplify it and automate it and just do it on the tax system. And then we'd also like the flexibility to, within our service level standard or the number of units that we're required to provide in the city, we'd like to include a variety of housing options, including housing allowances, a new form of rent geared income at various levels, and for the the right purpose at the right time. So we've actually asked for all of those things.
Would the province, in your opinion, agree to less per household, but stretching it 50% further or 60% further?
I would suspect yes, because the rent geared income program has been basically locked in time. That was a formula that was created 15, 20 years ago, and all the programs since then have all been housing allowance programs with much lower amounts, fixed amounts. We've done as much as we can with those housing allowances, so we need a more robust program that includes all of those different housing options, and the province has recognized all of them. They just haven't created a good framework that allows us to make the decisions we need to make and provide all those different options.
Certainly, from what I can see, and gosh, am I at 10 minutes? From what I can see, if you get slightly more federal and provincial participation, change the rules, you could turn that 11,000 units into 20,000 units.
We'd have to look at who's being served, because some of those folks do need deep subsidy. Some of them do need the 8,000. Some may not. So we'd have to do we'd have to figure out, we'd have to do policy analysis to figure out what's the best approach.
Okay. All right. Thanks very much. Councillor Davis.
Thank you. I just wanted to ask again, the concern I have raised many times is that we are purchasing service essentially for housing in private market buildings that are, many of them, in very poor shape and have all kinds of outstanding violations for property standards. And I'm wondering when we're going to get the report that talks about how we can leverage property standards improvements through our rent supplement, housing allowance, and other financing of private housing.
So
I understand there's going to be another report.
Through you, Mr. Chair, my understanding is that discussion has started at the Tenant Issues Committee, and there's been some initial look at how many of these buildings that have private rent supplement agreements. There's about 2,700 units. How many have already been audited by MLS through their audit program? I think it's somewhere about a quarter to a third. And the question is, should we be auditing all of them, or what mechanism can we put in place? In future agreements, for example, we could put in specific provisions,
Yes.
and so on. So we're happy to have that discussion at the Tenant Issues Committee and see where it takes us.
Okay. And are those agreements available?
We could certainly provide a generic.
Sample, the generic.
A generic.
What are the
agreement.
kinds of conditions we put into those agreements?
Well, there's a lot of things in terms, there is in terms of the state of the condition of the unit and the level of rent, the market rent, which caps the amount of subsidy that we would have to provide, and the fact that we applicants come off our wait list and we choose them, and we actually calculate the RGI for those units. So it's mostly about the service that the landlord's going to provide.
Right. And in many instances, can you remind me, we pay directly for rent supplements to the landlord?
Yes.
We pay cash to, we pay to residents for the housing allowances. Is that right?
Yes. Housing allowances are paid directly to the resident. Rent supplement agreements are an agreement with the landlord. Basically, they collect a rent, a lower rent from the household, 30% of their income, and the rent supplement tops up the amount to get to what would otherwise be their market rent for that unit, or whatever their rent is for that unit, and we would pay them, monthly, just like they would be collecting rent.
Okay. So when is that report coming?
Well, since I generally have not been attending the 10 issues, my understanding is that there's a discussion in the 10 issues committee. I don't know if there's a report coming to the next meeting, or I could follow up to find out what's happening. But that's where that discussion is unfolding.
Okay, thank you.
Thank you, Councillor Davis. Councillor Bailão?
Okay, I have a few questions. So what is the average that we pay, that the city pays and landlord for the rent?
I'd have to take my calculator, but it's basically $88 million divided by the 11,000 units.
8,000.
No, I want to know the difference between a private landlord and TCHC.
Oh, so Toronto Community Housing, the average RGI, I just heard the number the other day, is somewhere around $500.
So the city gives about, in order to produce an RGI?
Per $500, so it's about $6,000 a year, so it's a little bit less. And that's partly because for the public housing, that's most of Toronto Community Housing stock, it's not a market rent that's we're paying up to. It's actually it's actually sort of the real cost of running that building, and because those buildings are older, the debt cost is less.
So 500 to TCHC, is it 88 million to 11,000 divided, or is it a different number taking out the TCHC units?
TCHC, there are some rent
Can you get me that number?
Sure.
Okay. And you talk about the rent supplement unit being reviewed annually. So how are we doing that rent review? Is it Housing Connections that is doing that review of the RGI?
For the rent supplements, it's Housing Connections, yes.
So they have to come to the Housing Connections office?
Yes.
Okay. Housing, so you're saying that unlike the Strong Neighborhood Program, so these are not from the Housing Connection lists. So these subsidies, the people don't come from the Housing Connections?
For these rent supplements?
Or the Strong Communities Program?
So the Strong Communities, most of them actually do come from the wait list.
Most of them, but there's
some of them, because when that program was created about 15 years ago by the province, they required that some of the units be provided for people with special needs. So they were actually allocated to agencies that had funding from the LINs and so on, that they were actually referred by those organizations. So in that case, for those particular units, which I don't know what portion is, but it's probably less than a third of the units, maybe a quarter, there are actually people referred by the LINs to those programs.
And this is paid by the provincial government? This program is 100% covered by the provincial government?
That program is paid by the provincial government, yeah.
Okay. Housing allowances, they're not coming from the list, from the Housing Connections list?
No, they're not currently, no.
Okay.
There may be, the people receiving the housing allowances could potentially be on the list, but we're not using the
And we're not
list.
cross-referencing?
Generally, no.
Is that something you're working on with the review of the housing's waiting
Yes.
list and the choice-based
Yes.
program?
That's
So
one of
that
the
is
reasons,
gonna
that's
be addressed
exactly
in
why we're looking at trying to sync up and provide different housing options.
If you could.
So on your
Sorry,
program
just on a
agreements.
point of order.
question.
I have to go. We've kind of, it's been a light agenda, and we're here still at 4:30.
Well, I beg to disagree. I thought it was a
No,
very
relatively
substantial
number of items.
agenda. It's a miracle that we're done at this time, actually.
All joking aside, we'll only have quorum for another minute or so, so.
Okay, I'll take my questions offline. And-
Would you like to defer the item again, and
No,
we'll
no,
come
no,
back
no,
to it?
not at all. I'll take my questions offline. No problem.
Okay.
I don't need to speak on it. It's just.
A motion to move receipt. All those in favor? We're adjourned.
Thank you.
Thank you very much, everybody.